For public hearing,
Because I don't want to.
Yes.
the
You have to pass the 40 button.
public hearing called to order. Deputy Clerk, please read the call to the public hearing.
Notice is hereby given by the Chair of the St. Lawrence County Board of Legislators that the Chair and the members of the Board of Legislators of the County of St. Lawrence will meet at the Board of Legislators Chambers Courthouse located at 48 Court Street, Canton, New York at 5:40 on Monday, December 6, 2021 for the purpose of conducting a public hearing regarding the adoption of the 2022 budget. Further notice is hereby given that copies of the tentative budget are available at the office of the Clerk of the Board of Legislators at Canton, New York, where they may be inspected or procured by any interested person during business hours. Pursuant to Section 359 of County Law, the maximum salaries that may be fixed and payable during said fiscal year to members of said Board of Legislators and to the Chair thereof respectively are hereby specified as follows. Members of the Board of Legislators, $12,000. Vice Chair of the Board of Legislators, $14,000. Chair of the Board of Legislators, $17,000. 2022 budget summary. Exhibit A, general government support, $55,916,591. Education, $706,000. Public safety, $19,327,788. Health, $16,696,651. Transportation, $26,246,256. Economic assistance opportunity, $76,262,478. Culture and recreation, $491,282. Home and community services, $7,160,524. Employee benefits, $39,492,966. Debt service, $2,332,438. Interfund transfers, $15,990,271. Total appropriations, $260,623,245.
Does anyone wish to comment? No one wishing to comment? Public hearing closed.
Board of Legislators, that the chair and the members of the Board of Legislators of the County of St. Lawrence will meet at the Board of Legislators Chambers Courthouse located at 48 Court Street, Canton, New York, at 5:50 on Monday, December 6, 2021, for the purpose of conducting a public hearing regarding proposed local law D for the year 2021, reapportioning 15 legislative districts in St. Lawrence County. Be it enacted by the Board of Legislators of the County of St. Lawrence as follows. Section 1, legislative intent. This local law is intended to fulfill the requirements of the United States Constitution that there be substantially equal representation of the population of St. Lawrence County in St. Lawrence County Board of Legislators, and to meet the requirements set forth in New York State statutory and decisional law regarding legislative representation. The St. Lawrence County Board of Legislators has chosen to do this by continuing the existing number of legislative districts, 15, and modifying some of the legislative district boundaries to achieve fair and equitable representation in the county legislature based on the results of the United States 2020 Census of Population as modified by New York State statute regarding the residents of state prison inmates for purpose of legislative representation. Section 2, district boundaries. As used in the local law, election district or election districts mean those election districts established by the St. Lawrence County Board of Elections and in effort in October 2021. Each such election district is identified by the name of the town or city in which it is located and by a number assigned to such district. The legislative districts established by this local law consist of areas of the county described below by reference to entire towns or portions of a town or the city of Ogdensburg that constitutes one or more election districts. The boundaries of legislative districts are established by the boundaries of the towns, the city, and election districts, if any, included in the description below. The boundaries follow municipal boundaries and street, river, and stream center lines.
I'm having trouble hearing because of the noise out there.
District 1, that portion of the city of Ogdensburg designated Ogdensburg election districts 1, 2, 3, and 4. District 2, the entire town of Lisbon and that portion of the city of Ogdensburg designated Ogdensburg election districts 5 and 6. District 3, the entire towns of Morristown and Oswegatchie and that portion of the town of Canton designated Canton election districts 4 and 7. District 4, the entire towns of Edwards, Fowler, Hammond, Macomb, Pitcairn, and Rossi. District 5, the entire towns of Gouverneur and DePoyster. District 6, the entire towns of Clare, Clifton, DeKalb, Fine, Herman, and Russell. District 7, the entire towns of Colton, Hopkinton, Harrisville, Piercefield, and Pierpont. District 8, the entire town of Madrid and that portion of the town of Potsdam designated Potsdam election district 1 and 2, and that portion of the town of Canton designated Canton election district 2 and 8. District 9, that portion of the town of Canton designated Canton election districts 1, 3, 5, and 6. District 10, that portion of the town of Potsdam designated Potsdam election districts 5 and 6. District 11, the entire town of Stockholm and the portion of the town of Potsdam designated Potsdam election districts 4 and 7. District 12, the entire town of Norfolk and that portion of the town of Potsdam designated Potsdam election districts 3 and 8. District 13, the entire towns of Brazier and Lawrence and that portion of the town of Messina designated Messina election districts 7 and 8. District 14, that portion of the town of Messina designated Messina election districts 1, 3, 4, 5, and 6. District 15, the entire towns of Louisville and Waddington and that portion of the town of Messina election district 2. The boundaries of the legislative districts established by this local law are shown on a maps marked Exhibit A through A15 detailed, copies of which will be filed with the St. Lawrence County Clerk's Office immediately after the effective date of this local law. Section 3. If any clause, sentence, paragraph, subdivision, section, or part of this local law is adjudged by a court of competent jurisdiction to be invalid, such judgment shall not affect, impair, or invalidate the remainder of this local law. Section 4. The provision of this local law shall supersede all the provisions of local law number 1 of 2012, which established the county legislative districts following the 2010 United States Census of Population. Section 5, the legislative district established by this local law shall be effective beginning with the election of the county legislator to be held in November 2022. This local law shall take effect 45 days after its adoption, or if submitted to a referendum. This local law will take effect when approved by the affirmative vote of a majority of qualified electors of the county voting for its approval, and when it has been duly filed with the New York State Secretary of State as provided by the Municipal Home Rule Law.
Anyone wish to comment on this public hearing? Public hearing is closed. a procedure to allow for the attendance of legislators telephonically. Second, Mr. Forsythe. All in favor?
Aye.
Opposed? Carried. Kelly, can we have a roll call vote? Or roll call attendance, please?
Sure. Reagan,
Here.
Forsythe,
Here.
Lightfoot,
Here.
Sheridan,
Here.
Smithers,
Here.
Denisha,
Here.
Perkins.
Mr. Perkins is excused tonight.
I see he's on the camera.
Oh, he is? Okay. Thank you. He is.
Akers,
Here.
Fay,
Here.
Haggard,
Here.
Fiaco,
Here.
Burke,
Here.
Arquette.
Here.
Terminelli.
Here.
Curran,
Here.
15 present.
Okay, thank you. We have a prayer offered by legislator Denisha. Followed by the pledge of allegiance.
Larry, if I could be the microphone, just so folks out there could also hear.
Your prayer heads, please. Dear Heavenly Father, thank you for allowing us to assemble here this evening in your presence. We give thanks for each loved one, friend, and colleague whom we remember this evening, for all the ways their lives touched ours, for the difficult times as well as the good times, for the ways in which their lives, love, and friendship continue to be with us. But in our sadness and with thanksgiving, we remember them. Please guide and protect us through the coming days and grant us the strength that only you can provide. When our evening's work has been completed, we ask that you guide each of us on our journeys home. For all these things, we ask your divine guidance and blessings through your Son, Jesus Christ, in whose name all things are possible. Amen.
Amen.
Pledge allegiance
To the flag of the United States of America, and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
St. Lawrence County Board of Legislators is honored to pay tribute to two individuals who served on the St. Lawrence County Legislature through their roles as former supervisor. Well, they weren't on the legislature before there was a legislature. They served in their roles as the former supervisor and former legislator of St. Lawrence County. This memorial stands as a testament to their dedication and hard work. Their invaluable service will not be forgotten, and they have faithfully contributed their time and energy to serve the citizens of St. Lawrence County. Mr. Levi Kio, Mr. Kio was welcomed as a new member of the Board of Supervisors at the organizational meeting on January 3rd, 1972, representing the town of Herman and earning $2,400 yearly. He was chosen to serve on the legislative, fire, and standing committees for 1973. Mr. Kio served 2 years as supervisor before the board changed from the supervisors to the legislators in 1974. Mr. Frederick Stanley Morrill was also a legislator on this legislative body for District 6 in 2007, serving as vice chair in 2008 and again in 2010. Mr. Morrill said his two greatest accomplishments that he championed while saving was saving the Meals on Wheels program and cleaning up super sites. Mr. Morrill served his constituents and all the citizens in St. Lawrence County dutifully for 7 years. Family of Mr. Levi Kio will be asked to enter the board, which they're here already in the chambers. And I think Mr. Legislator Denisha is a resolution that he would like to read.
Mr. Chairman, I offer a resolution in memoriam of the deceased member of the St. Lawrence County Board of Legislators. Whereas during the past year, we have lost in our ranks Levi Kio, supervisor. Whereas this man was recognized as a leader in his community and was chosen to serve on the Board of Supervisors representing the town of Herman from 1972 to 1973, as well as performing other duties for his fellow citizens. And he honorably and diligently discharged the trust so reposed in him, and he has now departed, leaving a record which we remember and which today we seek to commemorate. Now therefore be it resolved that we treasure the qualities of service and devotion to this, our absent friend. We rejoice in the work he accomplished and sorrow that he is no longer with us. And be it further resolved that in token of our respect to this departed associate, this resolution be included in our records as a permanent memorial to his time spent with us. Move for its adoption.
Seconded by everyone in attendance, I believe, including on the screen as well. All legislators made that second. Okay, all in favor?
Aye.
Is there anyone opposed? Carried unanimously. Proud.
Mr. Chair,
Yes.
I didn't know Mr. Kyle. We call it Kyle over our way now. I can tell by the size of the participants that came here today. He was a heck of a family guy, and we can be proud of that. And doing this job, we can be proud of that as well.
He's probably got his name right there.
Yes.
I had this great pleasure of knowing Levi and Ella both from the time I was just a little guy. Doesn't seem like a long time ago, but it was. And my dad and mom were great friends of Levi and Ella's. I actually met them to school. So it was a great honor to have the privilege to present the resolution to you this evening.
Okay, if you'd like, you can stand at this time. Mr. Kio and the framed certified resolution and a bouquet of flowers. Did the resolution already go?
Yeah, thank you.
And a bouquet, if I saw the flowers, okay.
We need to vote,
And
Bill, on
then,
the resolution.
And then we need to vote on that resolution. And all in favor?
Aye.
Opposed? Carried. Resolution carries.
What you want to do?
And at this time, the family of Levi Carroll will have the opportunity to speak to the Board of Legislators.
Don't be shy.
I, for one, want to thank you guys for what you did. Dad was here, he'd be very tickled pink about what you've done for it. Mr. Denisha, you know it well. You know what kind of man he was. And as you know, this is the family, this is the closest. And we are very proud of Dad. Very, very proud. And I'm glad you guys accept that too. Thank you.
Well,
I just want to say that my son and I came and celebrated my dad's 90th birthday. We let him drive. But my son was saying prayer in that seat. But he showed us where he was born in Cal, what home he lived in, because they had midwives. But he was a very good dad. Thank you.
Thank you.
I also have to add that he didn't go see the eye doctor because he knew they were gonna take his license away.
I didn't know it.
Going through that right now.
You know, I don't want to stand up and talk, but he did talk a lot about the county stuff.
Citizens
The
Patrol.
citizen patrol right up through to everything he did for Herman, so.
He had some good stories.
He talked about being a member of the county board of legislators for almost every month. I mean, my wife and I took care of him on these last days for a few years. And like I say, at least once a month, we would mention how I served on the county board of legislators, and he was proud of it. He talked about his name being on the plaque over at the county building across the road, you know, the welfare building, his name's on the plaque over there. He was serving at the time that came about. And he bragged to people because of the board, that's why that building's there, you know? And he was proud to be a member at the time. So I need to say it. Really proud of him, miss him terribly.
well, you should be very proud of him. There's no greater challenge, and there's no greater honor than to be in public service. You did a fine job representing people in St. Lawrence County. Okay. Thank you.
Thank you so much for coming. Thank you for coming. Take care. Thanks so much for coming.
I was thinking that Fred Morrell's family was in here too. I
Yeah,
shouldn't have done
sorry.
that, but
You
I'll
can
read
read.
it again.
Yeah.
Dave?
Tonight, sir. You're all ready for Christmas? Santa Claus gonna come and visit you. So you're on a nice list and not a naughty list. He's making a list, and checking it twice.
St. Lawrence County Board of Legislators is honored to pay tribute to Mr. Morrell tonight. Mr. Frederick Stanley Morrell began serving as legislator for District 6 in 2007, serving as a vice chair in 2008 and again in 2010. Mr. Morrell said his two greatest accomplishments that he championed while saving the Meals on Wheels program and cleaning up the super sites. Mr. Morrow served his constituents and all of the citizens of St. Lawrence County dutifully for 7 years. I think we have a resolution to be read by Mr. Denisha this time.
Mr. Chairman, I offer a resolution in memoriam of the deceased member of the St. Louis County Board of Legislators. Whereas during the past year, we have lost from our ranks Frederick S. Morrow, legislator. Whereas this man was recognized as a leader in his community and was chosen to serve on the Board of Legislators representing District 6 from 2007 to 2014, serving as vice chair from 2008 to 2009, and again from 2010 to 2011, as well as performing other duties for his fellow citizens. He honorably and diligently discharged the trust so reposed in him, he is now departed, leaving a record which we remember and which today we seek memory. Now therefore be it resolved that we treasure the qualities of service and devotion, duty of this, our absent friend, that we rejoice in the work he accomplished, and sorrow that he is no longer with us. Be it further resolved that in token of our respect to this departed associate, this resolution be included in our records as a permanent memorial to his time spent. And move its adoption.
Second by Mr. Forsyth, seconded by Mr. Smithers and Mr. Lightfoot. And it appears every single legislator in the legislative chambers on the screen is seconded it. Is there any discussion by any of the legislators? Yes, go ahead, Mr. Forsyth.
Thank you, Mr. Chair. Fred and I served back originally in 2007. We came out at the same time. We replaced his dad at the time, as you all know. We didn't agree on, but two of the things we found common ground, the super J&L. I remember I was sitting right there, and Fred wanted that cleaned up in the worst way and wanted to start it yesterday. And a lively discussion took place, and I stepped in and said, I'll only agree if we had hired an environmental attorney. And Peter Lecky was the attorney. He says, I agree with Dave, it's a good idea. People of Star Lake line, old Fred Morrow will come, because that site is cleaned up because of that. And St. Lawrence County owes me a little bit, because we still have Gary Bowich to this day, who's cleaned up all sorts of property. But that was the first one, and that was the big one. And the other common ground was fishing. We enjoy talking about fishing. He will be back. And he will be.
Yes, go ahead.
And Fred and I were adversaries politically, but we were both farmers. So our love of working with the land, the family, working with the cows, we could try and meet in the middle. And Fred loved fishing, and I had never really done much fishing, but other than bullhead fishing, because really Fred never really counted that as fishing. And he invited me to go on his boat at some point in time. I never got there, but I think he really wanted me to get on the boat because I get motion sickness. I think he wanted to throw me over. But, Fred was a great man, and I miss him.
Bill.
Go ahead. Mr. Denisha.
Thank you, Mr. Chairman. Fred and I we went to school together, right from day one. We were in kindergarten together, and we graduated together. And we had a lot of things in common. There were things we didn't have in common. That was okay. And I remember Fred. One of the things we didn't have in common, he was a Red Sox fan, not a Yankees. And I remember in 6th grade, I shouldn't say this because I'm really dating myself, but in 6th grade, we had a mock election
as to whether it was going to be JFK or Richard Nixon. And Fred campaigned for JFK, and I campaigned for Richard Nixon. We don't know how that worked out. But Fred was a good friend, a lot of good memories, and he really was.
Bill,
Yes,
Tony on the screen.
Tony, go ahead, Tony.
Thank you, Mr. Chairman. When you first come into county government, as I did 3 terms ago, can be quite an eye-opening experience. There's a lot of nuts and bolts. And I learned very quickly that Fred Morrill knew the inner workings as well as anybody on the board. And what I really admired and appreciated with Fred is that if you had questions, if you had trouble getting your arms around anything, he would explain it to you. He always lent himself to other folks, the younger folks, for advice and how to move forward. And he will be greatly missed. He was a very good man and a strong family man. So my deepest condolences.
Is there anyone else on the screen? Is that hand, is your hand raised, Ms. Kern? She's got her hand up, is she wanting to talk? Ms. Kern, read it. Okay, it's now, is it time for a vote? All in favor of that resolution?
Aye.
Anyone opposed? Carried. Now, the family will all stand.
I think there's someone other than the presentation. If you don't mind. Someone else. Is there a Democrat in the house?
Of course there is.
Yeah.
There are 2. Go ahead, Ian.
Dan Fay.
I'm kind of embarrassed to present this because when he came back to school, I was one of his faculty members. And he might have taught me more than I taught him. Would like to accept this. Congratulations.
Thank you.
Thank you very much.
They're pretty.
Okay.
Thank you. Thank you. This is Stanley.
Hi, Stanley.
Little Stanley. He was named after his great grandpa.
Yeah.
Well, I was on the legislature when there were 22 legislators here, and Stan Morrill sat right back there. And boy, when he voted, we knew about it. He had a lot of yes. That I never heard. But
Stanley's going to take his place, that's for sure.
Just walk now. Come on.
okay, thank you.
Thank you. Thank you. Oh, my God. Thank you. Bye, mister. Have a good night.
On the agenda is approval of the agenda. Do we have a motion? Mr. Smithers makes the motion to approve the agenda, seconded by Mr. Burke. All in favor?
Aye.
Opposed? Carried. Approval of the minutes for November 1st, 2021, full board meeting. Motion by Mr. Burke and seconded by Mr. Smithers. All in favor?
Aye.
Opposed? Carried. The next thing on the agenda is COVID-19 update. We have Dr. Williams.
Yes.
And is Jolene with us tonight, Doctor?
I'm here.
Okay, you are here, Jolene. Okay, thank you. Would you rather go first, Jolene, or would you like Dr. Williams?
I'll go first.
she said.
She's going first.
She's gonna go first.
Okay, can you see the presentation? Right. I got a new setup, so we're just making sure. Okay, so as of today, we have 15,464 cases to date. We had 34 hospitalizations today, and we have 809 people actively on isolation, and 14,509 have completed isolation, and we do have 146 cumulative deaths. Our daily hospitalizations are, like I said, are at 34, and as you can see, they've been rising and staying higher, and Dr. Williams will be talking a little bit more about hospitalizations. But just as you can see the trend over the summer, we've got nice and low, and we've been steadily high in the 30s. And we've been there the whole, granted we're only 6 days into December, but we've been there the whole month of December. For our weekly cases, we still have 1 day left in our reporting week for this, but we're up to 671 cases for the week. So that's from the December 1st to December 6th, 671 cases. Last week we had 560, the week before that 555, the week before that 479. So we are trending up upwards. Our average new daily cases per day for the week, currently with the 6 day average the 6 day week that we have right now, we're at 112 cases a day that we are processing through our office right now. Last week we had 80, and the last 2 weeks we've had 80. Our weekly school cases are also going up. So these are K-12 school cases. This is anybody that it could be a student, could be faculty, staff. So far for the month of December, we've had 153 cases just in the last 6 days. For November, our total was 549. October, we had 435, and September, we had 476. So we are starting to trend up in the schools. Our colleges, so far in the last 6 days, we've had 35 for the month of December. And we, the averages for the colleges have been, they've been jumping. So we either have a low number or a high number, and that goes with how much testing they're doing. Some weeks they're testing all of them. Some weeks they're only testing the unvaccinated. So for our isolation and quarantine total, so we have 809 on the active isolation, and then we have 1,525 on quarantine, and so total that has been through our whole process is 64,696. So our monthly cases by age group for November, we had 2,166 cases, and 26% of those cases were in the 0 to 19 range. 38% were that 20 to 44 range, and that is where our branch where we have our lowest vaccination rates right now. For December, we have 677 cases to date. For comparison, for November, or for October, we had 1,979 cases. Hospitalizations, we are up to, in November, we had 110 people hospitalized. We did have a few people in the 0 to 19 range, but a lot of the, it kind of is equal out for the percentages throughout the 20 to 44, and then the 55 to 64 and 65 to 74 are where the majority of our hospitalizations are coming from. So far in December, we have had 11 hospitalizations this month. So just our county statistics, we are in a high transmission zone still. Our positivity rate, according to the CDC today, was 9.8. The total population that is fully vaccinated is 56.6. For the total population with at least one dose, we're up to 60.7. Our 12 and older that's fully vaccinated is 64.5, and the one dose is 67.9. The 18 plus for fully vaccinated is 65.4%, and one dose is 68.9%. 65 plus has always been our best group. We're at 84.2% for fully vaccinated and 88.4% for one dose. And just a new statistic, for the 5 to 11-year-olds, we are at 19.65% as of yesterday, which is great for our county just starting off within the first month being at 20%. And an update on our school testing program. So this is the K-12 program that is required for all unvaccinated faculty, staff, and optional for vaccinated staff and students. We've done a total of 9,265 tests. And out of those tests, we found 67 positives. We also received about approximately 100 Binax boxes that are rapid tests that were delivered to the schools between last week and some are coming this week that they can also use for rapid testing in the schools. And then we are anticipating additional over-the-counter kits to be coming in. I'm not sure of the brand or when they will get in, but that is what New York State has said will be coming to us. For our vaccine distribution, we have, as a public health department, done 7,418 first doses, 6,108 second doses, and 700 booster doses so far. So during the month of December, every Monday from 8:30 to 2:30, where the Pfizer 12 and older is available at public health. This is for first, second, and booster doses. We are hosting a Moderna booster clinic on Friday, December 10th from 8:30 to 3:30. And then we're hosting a Moderna and Johnson & Johnson booster clinic on Friday, December 17th from 8:30 to 3:30. And Johnson & Johnson will also be available for first doses. So if you want first dose, booster dose, you can come in for either for that. And then for county employees only, we are hosting a clinic on Wednesday, December 15th, and that will be at 2 locations. One will be at the board office where you guys are all sitting right now, and then the other will be at our office. We finished up last week our first round of school vaccine clinics. So we started our second doses today. But you can see we did 554 students at the schools. We hit every public elementary school in 9 days. So it was quite an interesting feat to get it all done. And the schools have been fantastic partners in it. About 554 done at the schools. We are also considering a potential county testing site. So we're in talks with Quadrant Biosciences and the county administration to open a COVID testing site for individuals with symptoms only. This would not be for anybody that doesn't have symptoms and wants to go to Canada for pre-op. This would just strictly be for people with symptoms. It is the PCR cheek swab. The turnaround time with these tests is approximately 48 hours. The individuals do need to have an email address to be eligible to go through Quadrant because of how their test results are sent and how their app is set up. There is no cost to the patients. Insurance is billed. If an individual does not have insurance, then they collect under the CARES Act, but it is no patient billing, similar to what the hospitals are doing. So still under consideration for this to move forward. We are looking, trying to determine what the best space would be, who would staff it, and then a courier service to get the swabs down to Syracuse. And then just as a reminder, we are seeing a lot more of people in the county testing positive with a home test. If you test positive on the home test, if you do not call our office, we do not know that you tested positive. We can't contact your families. We can't contact your contacts. We can't give you a letter that you need for work. So if you take a home test, take a picture of the test, give us a call, and we'll walk you through the next steps. We are encouraging people to take a home test if that's what's available. But if you test positive, the only way we're going to know is if you call our office. And if you get after hours or a message, just leave us a voicemail and we will call you back. And if it is after hours, we do have our own call phone number. And that is all that I have. Dr. Williams?
Okay, good evening. Can everyone see my slide there? All right, so just a quick update in terms of what's happening on a national level. So unfortunately, we've now seen an uptick in cases. If you look at the trends for the past 14 days, there's a 19% increase in the past 14 days of cases, an 18% increase in hospitalization, and also an increase in deaths. As far as the geography, the Southwest and the Upper Midwest have been affected, but now it's fairly clear that the Michigan and the Northeast are also becoming hotspots. If you look at New York State trends, the St. Lawrence County is in, if you look at average daily cases per 100,000, we are close to as high as the highest other counties. The state itself has seen a 29% increase in cases over the past 14 days. And our county, again, in comparison to the rest of the state, we were number 11 as of yesterday with new daily cases per 100,000. I thought this was a helpful graphic just to understand where we are right now. So this is December 1st, looking at the map of the county. If you compare it to December 1st in 2020, you can see graphically that we're in a much tougher spot. We're starting out the winter with many more cases than we did last year. If you look at hospitalizations, and this is something I'm going to focus on a little bit tonight. So for regional hospital trends, and so this is the 7-county region.
Dr. Williams?
Yeah.
Sorry to interrupt. The slide has not moved forward.
Okay.
So I'm not sure if you wanted to reshare.
Sure.
Sorry about that.
No, my bad.
I want to make sure that everyone can follow along.
What slide are you able to see?
The last slide was the slide with the United States with the circles over the Midwest and the East Coast.
Okay. How about now?
Nothing yet.
Okay, let me try that again. I apologize.
That's okay.
Are you able to see this?
Now we can see New York State.
Yeah, that's the next one.
Okay. So let's try that again. Still see New York State with a. Okay, how about now for the look back?
Just New York State.
Okay. Oh my.
When you share your screen, are you able to share the most upper left-hand option, which that'll share whatever's on your screen at that time rather than the specific window or program?
Say that again, Dylan.
Are you able to share, when you go to share, the most upper left-hand option should share whatever's on your main screen at that time, rather than picking a certain program or a certain window of to share?
So that time we did see the December 1st to December 1st, Dr. Williams.
Okay. So I'm just going to the bottom and I'm doing share screen. And I'm picking. What are you seeing now?
The December to December.
Okay.
There we go.
Yep.
Now you're moving.
Okay. And then how about, all right, so this is looking at the hospitalizations for the North Country region. And what you see is, and this is a 7-county region, if you look at the winter of 2021, we had a very difficult time, but we had a pretty defined spike and then a decline. If you look starting in the fall for this year, we had a pretty sharp climb, then a peak. But as you can see, we actually continue to ascend in the number of hospitalizations, and it's fairly dramatic, and it's across the region. It's St. Lawrence County, but it's affecting all of our regional partners, which is very important in terms of where we're able to send patients or not send patients. One thing that is important to realize is if you compare the North Country region and our hospitalization trends to the rest of New York State, so all regions, what you see is that we've had this very difficult fall, and then we continue to have this sharp peak going into the winter, whereas the rest of the state largely has had a fairly quiet fall and is now just starting to see the increase in cases that we're seeing within our region. Another way to look at this, just kind of real time in St. Lawrence County, is if you look at the two largest acute care hospitals in St. Lawrence County. So if you look at the inpatient census, so that people who are in the hospital at Canton Potsdam, and you look at Claxon Hepburn Medical Center, and this is data just from yesterday, you'll see that of all the patients who are in medical surgical beds and ICU beds, 35% of them, so more than a third of our patients, are patients who are admitted because of COVID. The other 65% are patients with, heart attacks and infections and blood clots and things like that. But 35% of our patients are there just because of COVID. The graphic with all the beds just shows this another way. So again, of all the acute care beds that are available at CPH and Claxon Hepburn, there's a large portion of people who are there because of COVID. I did want to mention the vaccination rates, and as Jolene said, for full vaccination in St. Lawrence County, we're at 56%, which is important. But if you look at New York State, it's 68%. So we're quite a bit below just the state average, and the way in which we're below is important. So if you look at St. Lawrence County, and you look at the New York State, if you look at the age demographics, so for the folks who are 55 and older, we're fairly comparable to New York State as a whole. However, if you start looking at the younger and middle-aged population, we're somewhere between 13 and 20% below the state vaccination rate. Now, the good news piece is that for our 5 to 11 age group, we are at 20%, whereas the state is at 19% if you round the numbers. So that just shows you that our county does a very good job getting vaccination out to people who want it. Our challenge is this kind of young adult to middle-aged adult age group. One of the factors with our increasing cases, I think, is what's happening in the pre-K through 12 schools, and as Jolene mentioned. So if you look at the, if you look at the decision making, the value of in-person education, I think everyone felt very strongly was greater than the potential risk of COVID. I do think that some of the decision making was based on the pre-Delta variant paradigm. So before Delta, it seemed very clear that community prevalence was driving school prevalence. And last year, with Alpha and the previous variants, it did seem like children were less likely to be infected. However, I think right now, St. Lawrence County is facing this issue where Delta is, highly contagious, more contagious than Alpha, and school children are actually highly likely to be infected, as Jolene showed. We also have a high community prevalence that's increasing. We have unvaccinated students and staff, either by choice or based on their eligibility. Our background community vaccination rate is relatively low. And, I think honestly, we have variable community participation in mitigation efforts. And I think most of our schools have chosen to continue their non-classroom activities, after school activities and so on. And I'd say there's variable mitigation measures during those activities. As far as vaccine effectiveness and breakthrough cases, I did want to just kind of review this. So fully vaccinated individuals who develop COVID infection are considered breakthrough cases. Do breakthrough cases happen? Absolutely, they happen. They happen with a greater frequency than anyone would like. But the most important question is, are the vaccines still reducing hospitalization and death for the people who are vaccinated? And the very clear answer is yes. If you look at the graphic on this side, this is for the United States. And what you see is over time, so this is in the summertime, this is late summer, this is fall, and all the way through November, the rate of hospitalization for people who are unvaccinated is much higher than the rate of hospitalization for people who are vaccinated. So that would be a breakthrough hospitalization. So that's nationally. If you look at New York State, it's really the same graph. So unvaccinated people, again, are much more likely to be hospitalized than vaccinated people who would be considered breakthrough hospitalizations. People like to see the local data. And what I would show you is that it's pretty similar to what you see on a national level and what you see on a state level. So this is, I want to be clear, this is just a snapshot. This is looking at data from the hospitals from yesterday in St. Lawrence County. If you look at the number of people who are over the age 55 who are vaccinated in St. Lawrence County, it's slightly over 30,000. If you look at the St. Lawrence County residents over the age of 55 who are unvaccinated, it's slightly below 4,000. The reason I picked age 55 is that's our greatest risk population for hospitalization. So it's an important group to look at. If you look at this whole green set of blocks, if each of these rectangles represents 215 people, this is what over 30,000 people look like. And if you look at who's currently hospitalized, underneath that is the number 9. So out of more than 30,000 people, there are 9 people who are currently hospitalized, which would be breakthrough infections. And if you look here, you would see the number 19. So the proportion of people admitted as a breakthrough case to the total protected population who's vaccinated is very tiny compared to the number of people who are hospitalized and unvaccinated. So this is just a snapshot to show you, again, that even in St. Lawrence County, the vaccines are doing what they're supposed to do, which is to reduce the risk of infection, to reduce the risk of hospitalization, and to reduce the risk of death. And you can see by a factor of 5 for infection, it decreases the risk of hospitalization by a factor of 10 and of death by a factor of 10. Those are national numbers, which are consistent with what we see in New York State, in the region, and in St. Lawrence County. So I did want to just talk briefly about Omicron, because a lot of discussion about the Omicron variant. So what is the Omicron variant? The variant is basically a group. It's a new version of the COVID virus that has 50 mutations, and about 30 of those mutations are on these little spike proteins that are part of the shell of the virus. And it's a group of mutations that we've not seen this number of mutations, and we've not seen this combination of mutations. If you look at where the variant has been found, and this map is already different from when I created it this morning. The Omicron variant started in Southern Africa and South Africa and Botswana, but very quickly was determined to be in Australia, in India, in Europe, in Scandinavia, cases in Canada, and then late last week there was a case in California, but very quickly we've realized that there are cases throughout the United States, including a report of at least 5 cases in New York City. What we'll find is that over the course of the next days and weeks, there'll be many cases found throughout the US. People wonder how this is tracked. The US actually doesn't have the most sophisticated way of tracking variants, but basically it's a combination of private entities, academic institutions, and the state and federal government. And then there's this database called GIS AID, which is an international group, including participation from the US, where they really keep track of and report variants. So this graphic basically shows the wave of variants that we've seen since this started. So the earlier variants were like the Wuhan variant, but then there was Epsilon. I mentioned Iota, Gamma, Beta, and Mu because those are variants that were at one point either variants of concern or variants of interest, and you didn't really hear much about them because they didn't do much. Last year, Alpha was the main variant that was causing a problem. This year, it's Delta. So we are still very much dealing with Delta, even while there's discussion about Omicron. As far as Omicron, we know some things, but there's a lot we don't know. I think it's pretty clear that it's more contagious. Whether or not it's likely to cause more severe illness, I think is very much in question. And honestly, the early information that we're getting out of South Africa is that it may actually be less severe, which would be excellent. As far as whether it's vaccine resistant, that is very unclear. We won't know that information for at least several weeks. I wanted to just switch to outpatient therapy that is available to people in St. Lawrence. And I really want to focus on this bottom graphic. So I talked before about IV monoclonal antibody therapy, and it's an antibody cocktail. It reduces hospitalization and death by about 70%. It shortens illness by about 4 days. It's appropriate mostly for people who are at high risk of having severe illness or death. People in St. Lawrence County are eligible for this, and when they get contacted with a positive test, if they get testing done through either Claxton Hepburn or St. Lawrence Health, they get a call from a nurse who does the initial screening. The good news is, just looking at 1 week, so last week, the 4 hospitals were able to administer 37 doses of this medication, which hopefully is keeping people out of the hospital. So we went from administering a very small amount, even 0 some week, to nearly 40 doses per week, which I think is a nice accomplishment. As far as new therapies that are coming out, Merck has a medication called molnupiravir. They initially had some very optimistic numbers, talking about a relative risk reduction of hospitalizations from 50% down to 30%. They initially said 50%, but then they adjusted it and said it was actually only 30% effective at keeping people out of the hospital or dying. The FDA, a subcommittee, did meet November 30th, and they voted only 13-10 to approve the medication. It then goes through the rest of the process with the FDA, the full FDA, and then the CDC. But I just point out that it was a 13-10 vote. And there were a number of concerns about the medication. That is all publicly available, and I would encourage people to look at it. I would also mention that, unlike the vaccines, where tens of thousands of people receive the vaccines during the clinical trials, for molnupiravir, there were less than 1,000 people in the study, and of those, only 385 actually received the medication. So people are making decisions about the safety and the effectiveness of this medication on a pretty small group of people. Pfizer has a medication called Paxlovid that is supposed to be about 90% effective at reducing hospitalization or death. We're not sure when that's going to be approved. They've asked for FDA authorization. The other thing that's important is that both medications do need to be administered early in the infection. And so getting testing done quickly is important, because both medications need to be given within the first week of illness. Second to last, I just wanted to remind everyone that as far as boosters, so the CDC and then New York State agreed that anyone 18 and older who's received their initial vaccine series is eligible for a booster. If it was a J&J for the initial dose, you wait 2 months. For everything else, it was 6 months, and you can mix and match, so you can get a different follow-up booster vaccine. So finally, I just want to summarize and say that the national and regionally, there's an increase. St. Lawrence County and the North Country really are seeing a surge upon a surge. We're starting the winter in a much worse position than we were last year. And our local hospitals, I think, as you could see from those graphics, our local hospitals are very stressed. And this impacts the care for all illnesses. So it doesn't just impact the care for people with COVID, it impacts the care for people who are showing up to the hospital with a heart attack or with pneumonia or with a cellulitis. It is also likely going to impact our ability to offer preventative services and non-emergency procedures and surgeries. Our vaccination rate is lower than the rest of New York State, and this is mostly based on low rates in young and middle-aged residents. We know that Delta is impacting our school-aged children, and I think it is contributing, unfortunately, to the higher community rates, partly because we live in a county where there's lots of multi-generational households, which is a wonderful thing about our community, but is also tough in a pandemic. Omicron is definitely in New York, the state. It's either in St. Lawrence County or it's going to be here shortly. Right now, I think there are more questions than there are answers. It's probably more contagious. It may not be as severe, but we don't know that yet. And we don't know for sure how the vaccines are going to work, though early indications that the vaccine should work fine. IV antibody therapy is available, and it's especially beneficial to people who are at high risk. The oral medications, the molnupiravir is going to be approved shortly. Paxlovid is going to be approved, but it may be closer to the end of this year. And last, or almost last, is that vaccines really are our most critical tool. I would just urge people, if they've not been vaccinated, they should consider vaccination. And if you've already completed your vaccine series and you're eligible, you really should get a booster. Again, it's not time to panic. But if you look at the number and you look at the numbers at the hospitals and you look at our situation, it really is a time to take action. So that is my presentation.
Thank you, Doctor. Any questions from the legislator? Ms. Haggard?
Thank you, Mr. Chairman. Dr. Williams, you said now is the time to take action. What action are you referring to? What can we do?
Well, you know, I certainly this is up to the chairman and the legislator, but I think, you know, many counties have declared a state of emergency. And I think that really emphasizes to the community the seriousness of the situation and allows the county to leverage some powers in terms of getting aid from the state to increase testing and to help out the hospitals.
Thank you.
Mr. Swims?
On your map of the United States, you indicated that there was more concern in the central part, but in Florida and the South, it seemed like there were less cases there. And it seems like that's changed quite a bit from before, when those areas were being criticized for their lack of mandates, and it seemed like there were more cases there. Can you give us any kind of reason why it might be that they're less concerned there now than they were a while ago?
So I think, you know, the patterns as far as where this virus goes are not entirely clear to anyone. I think, you know, one of our challenges is with the weather changing. Certainly I speak for the Northeast, you know, with the weather changing, people are now indoors and there's a lot more contact than there was over the summer, for instance. That's one of the things people are putting out there as far as why you see these different changes in geography.
Ms. Kern?
I know over the weekend, I had the opportunity to be at the hospital a couple of times in a couple of days, and they literally were triaging people in the parking lot because they did not have any place to just bring a patient into the hospital and see them. So they had kind of said, hey, you know, like we're really backed up. Can you sort of mention that? But absolutely. I obviously leave it up to you guys to do the planning, but I mean, we really do have more patients right now than we can take care of in a timely manner. So whatever you think is something I would certainly be interested in listening to.
Any other, yes, Mr. Burke?
Dr. Williams, if the testing responsibility was taken away from the healthcare facilities, how much relief would that provide?
You know, it would provide some relief. We have one of our stresses is staffing. And, the people who staff the testing centers are clinical on one level or another. So it would take some relief off the hospitals, though I think because of the volume of testing that we do perform, and also the fact that we can do PCR within 24 hours, I would imagine that we would add, the county might add testing to the mix rather than replace what the hospitals are doing.
Mr. Lightfoot.
Dr. Williams, with regard to the state of emergency that you're talking about, can you tell me what you would hope to obtain as a result of a declaration of a state of emergency? You said something about supplies for the hospitals. What exactly would you be looking to get from such a declaration? And obviously not including the testing relief that you were just talking about.
So my understanding, and I might defer to Ruth or someone else on this, is that if there's a state of emergency, it allows us in our conversation or in our discussions with New York State to ask for support in terms of staffing, and whether it's staffing to actually come to the hospital or work, or to help with the nursing homes who are also dealing with staffing shortages, but to sort of leverage some of the power that the state has beyond what we're able to muster as a county or nonprofit hospitals.
Supplies of, if so, what kind?
Honestly, I think the most important supply that we're short of is people and staff. But I think I'll, also point out that as Representative Curran mentioned, Legislator Curran mentioned, the emergency room, I come to the hospital and people are being triaged, unfortunately, sometimes in the parking lot. And so we're working, at least at Canton Potsdam, but also the other hospitals at trying to expand our footprint within and make repurposed clinical spaces. But some hospitals are putting structures outside of their emergency rooms in order to take care of patients before they're admitted into the emergency room. I also want to underscore, and I may not have done a good job in my presentation, but this is a problem in St. Lawrence County. But what is affecting us pretty dramatically is that this is a problem in our region. And so our hospitals are wonderful, and we do our best. But many patients, when they become severely ill, end up being transferred to our tertiary care partners. So those are, St. Joe's, the Upstate, Plattsburgh, and so on and so forth. Those hospitals are all also overfilled. And so we have patients who show up to the emergency room and we contact not 2, not 5, not 10 hospitals. Sometimes we're contacting, I've heard up to 14 hospitals to transfer a critically ill person to the place that they need to be for the procedure that they need. So it's a local problem and we need to work on it locally, but this is a regional problem. And my biggest concern is that going into the winter where we're at right now, with cases increasing the way they are, it's really hard to see this not getting really difficult in the next weeks and months.
Mr. Chairman, I have a follow-up, if I may.
Just go ahead.
Doctor, the state of New York obviously is aware of the severity of the problem that we're having in upstate New York, the local area, the 7 North Country counties. Have they made any offer of any assistance, either with National Guard, manpower, supplies, any other kind of support recently?
So beginning last week, and again, Ruth may be able to speak to this, the New York State was describing things that they might be able to offer. And I think in the governor's declaration of the state of emergency, she specifically mentioned help with testing. She mentioned using the National Guard to help staff nursing homes. Those were 2 concrete things that I heard, and I believe there's been conversation pertaining to both of those specific options.
Thank you.
Go ahead, Mr. Akers.
Julie, do we continue to have about 1,000 people a week get vaccinated? Is that pace still the same or is it greater?
I think it's a little bit lower than that. It's right. So right now it's probably about that because we're doing the 5 to 11-year-olds. If you take the 5 to 11-year-olds out, the ones that just became eligible, you're looking at a lower rate for the ones that have been eligible since May.
So in the group that Dr. Williams referenced, the 55-year-olds, are we seeing much vaccination, people finally coming in and getting the vaccination? Or have you broken it down by age groups?
Other than the group categories that we have, I report out on most Mondays with where we're at for vaccination rates. And usually we're up like 0.1, 0.2% per week for our county groups for that 12 plus population and the 18 plus population. I do think the last couple of open clinics that we've had on Mondays where we're doing first doses, that we have seen more walk-ins for first and second doses. We are steady with booster shots, but we are starting, I think in the last 2 weeks, starting to see that increase with first doses again. But not to the point that we would like. We would like to see it increase more.
Has there been any movement about the state actually reenacting the site at SUNY Potsdam for the boosters? Because if you look online for boosters, they're 2-3 weeks out for appointments.
We have actively been asking for a state site and for state assistance, and we receive some assistance when it comes to the schools because that's what the program is for the back to school program for the 12 and older, and then the pediatric one for the 5 to 11. We've had some state help for that, but we have not had any state assistance. We're just doing regular clinics for boosters yet, but we are continuously asking for it.
Okay, thank you, Jillian.
Mr. Smithers.
Yeah, you mentioned, Dr. Williams, about staffing shortages. And my question is this related at all to the vaccine mandate for our health professionals? Legislator Curran a few weeks ago had this picture up there of other states offering nurses here, bonuses for going there to lure the nurses away. So can you give us any numbers on how many we've lost in recent weeks, probably or partly because of this vaccine mandate from the state?
Sure. So I can give you a general impression and estimates of numbers. So certainly I would say the vaccine mandate has impacted staffing to some extent. I think with St. Lawrence Health System, at the end of the day, that the number is somewhere in the 70 range across the health system. And again, I'm giving you just sort of estimates. Claxton Hepburn, I couldn't tell you for sure, but I think it's fair to say that it has impacted staffing levels. I will point out that it has also helped in some ways in the sense that throughout the pandemic, we've struggled with people being on quarantine, staff being on quarantine, or staff being sick. And so vaccines, certainly are helpful in that way. We've had before the mandate an issue where medical providers, nurses, respiratory therapists, and even physicians become what's called travelers. So anytime the country's in a health crisis, when Florida was having huge numbers of COVID cases, they were recruiting. And lots of people found it attractive to make $10 an hour more and go to Florida. So even before the mandate, we've seen a big drain on our workforce because people, basically follow these opportunities, and you can't blame them, but that's actually been much more of a challenge than the vaccine mandate, for instance.
Mr. Burke.
Dr. Williams, is there anything within the purview of the Department of Health, our county public health department, that can be done? I mean, can you somehow describe the situation that we're in and petition the state for help? I mean, I understand that declaring a state of emergency would help grease the skids a little bit. But I'm wondering, you know, I don't believe there's anybody in this room that has the depth of understanding that you and Jolene have. And I guess I'm just wondering if you could somehow define the problem so that we can go to the state and petition their help. We all saw what happened on the Channel 7 news when one night they're talking about the lack of help for Jefferson County. The next night, the state's responding. So I don't know that we would have the same luck, but at the very least, I think we should be a squeaky wheel as it relates to the health of our community.
I agree, and I guess I'm hoping that what we've talked about tonight or what I presented should count as squeaking. You know, again, I would just reiterate that we're in a tough spot. We've got a lot of incredibly dedicated nurses, you know, all kinds of support staff, physician staff, administrative people at the hospitals. But because we've been dealing with this Delta surge since September, and because it's not letting up, and because we now seem to have Omicron around the corner, I think if something doesn't give, what you're going to see is an already desperate situation turn worse, and the care that we're able to provide for our community is going to be compromised. And I want to emphasize why I think part of this does need to be us reaching to the state for help. We also can help ourselves in this community, right? So vaccinations do reduce the risk of hospitalization. They do reduce the risk of death. And we have a community that is under vaccinated relative to most other communities in New York State. So that's what people as individuals can do. And while we're looking to the state, I think we need to also think how we can help ourselves.
Dr. Williams, would you say that it's safe to say that the entire state of New York has a problem with a hospitalization situation where there's a shortage of beds?
Yeah, I mean, I think it's true across the entire state. But if you look at the map of New York State, and if you look at the relative hospital bed capacity, it's not consistent. So, you know, New York City right now, though this will change quickly, and some of the other more southern parts of this state are not in the situation we're in. Though we're in a bad situation, if you look at what's happening in Monroe County and some of those other counties in Western New York, they're in worse shape. So it's not homogenous, but we're toward the worst end of it.
The reason I ask that question is I know that I think there's like 62 counties in the state of New York, and I understand only 10 counties, at least as of up till yesterday or the day before, maybe today, have declared a state of emergency. Are you familiar with those statistics? And do you have any reason why there would only be 10 out of the entire 62 counties that are required or that are seeking the state of emergency status?
So I think it kind of reflects what I just said. It's pretty consistent with what they're seeing from their local hospital community. And I know, for instance, in Monroe County, they declare a state of emergency because their hospitals, you know, are kind of in the same situation where the hospitals are under duress, and they have these challenges, and they felt like declaring a state of emergency was the right move. I think the other counties that are doing it are also finding themselves in that same position. I anticipate that if Omicron does, you know, it has landed, if it does end up being as contagious as people expect, you'll see other counties and then in that same situation and making that same decision.
Thank you. Any other questions? Nothing on the screen? Nothing of Jolene as well? Questions of Jolene have been asked? Okay, thank you, Doctor. Thank you, Jolene. Okay. On to the next part of the agenda. Communications with Kelly.
Mr. Chair, we can read a statement.
You want me to go with the statement first?
Yes,
Okay.
please.
The traditionally, the communications received to the Board of Legislators have summarized at a board meeting and the communication provided to legislators in its entirety. And when COVID-19 began, we changed the procedure to allow the public to continue to participate without attending the meeting, but we will be returning to having the communications summarized tonight. And so during the citizen participation period, upon being recognized by the chair, speaker will state your name and you'll have 5 minutes or a time frame to be announced. And the total citizen participation time shall not exceed 30 minutes unless extended by the discretion of the chair. So we had a big memorial service tonight and we had public hearings and there's a lot on the agenda. Weather's bad. We've been pretty good over the past of giving the full extent of all the time we could give you for the public participation, but we're going to limit it now a little bit. So the total time period now should not exceed 30 minutes from those people who are speaking. So make sure to try to keep your comments to the 3-minute range or something like that. Try to keep it down. But we'll start out with William Room. Oh, do you have any others?
I do. I have some, yes.
She does, yeah, do hers first.
An email was received from Katrina Ducharme saying her 4 children have been in foster care for 4.5 years. 2 of the children were placed with Jameson and Erica Porter for 2 years, but have since been removed from their home. She demands that her 4 children be placed with the Porters and that the Porters be allowed to adopt them. An email was received from Jameson Porter of Jefferson County saying he and his wife were foster parents and the children were removed from their care. He is requesting the children be returned to their home in time for Christmas. An email was received from Leroy Spears saying his grandson was purposely taken and purposely placed with a DSS employee that fosters children. He and his wife would like the children placed with them. An email was received from Christopher Spears saying his nephew is in foster care and is being taken care of by a DSS employee. He is asking that the child be placed with his parents, the child's grandparents. An email was received from Leroy Spears II saying his nephew was placed in foster care since he was 2 days old, and that was 11 months ago. His parents want custody of the grandson, and he wants to know why the child was placed in foster care instead of with family. An email was received from Janet Miller asking the county to include a chewing tobacco addiction resource page to the county website. An email was received from Rachel Raven of Governor asking to be contacted by the outside firm hired to investigate social services so issues can be addressed. An email was received from Jackie Spears with questions to the legislators regarding her nephew being placed with foster DSS worker instead of with family. All of these emails will be mailed to legislators in their entirety.
Thank you. Okay, now with public participation, Mr. Room.
Greetings. Nice to see you all again. Over the last 10 months, I've enjoyed my opportunity to speak at public meetings. My position has always been, you're a service to me, you are public servants. I have filed an ethics complaint. My original commentary was about sexual abuse in our schools, reference to a local superintendent who was the son of a legislator. My original concern was still is the abuse of the power of these men and the justice and what they've done to the justice system to silence me. However, since then, other concerns have come up and my commentary has evolved. I do not belong to child. I'm not connected to the DSS concerns. However, I've listened to their stories And I have major ethical concerns about the county government and the actions of the county employees. Ethics is a morality of a group. The local ethics law protects everyone involved, and the unethical approach of this body when it comes to people is sad. I am not here as an adversary. I am posting out areas that the county needs to address. Thus, tonight, I wanted to talk about ethics, but however, anything concerning this body, another pressing issue arose. The issue is mental health and the need for reform. Now, if I were in a wheelchair, blind or deaf, and you were all here, you would make accommodations for my disability. But when I notify you that I have a mental health condition, it seems foreign to you. The county has real need to address mental health. I was going to talk about it in police reform, but something else came up. It's called the American with Disabilities Act. Title II prohibits the discrimination of disabilities by you guys. It requires public entities to make activities available to people like me, regulated and enforced by the U.S. Department of Justice. One provision, retaliation and coercion. No private public entity shall coerce, intimidate, threaten, or interfere with the right granted or protected under this act. You cannot deny me, based on my disability, the right to participate. You cannot afford an opportunity that is not equal to another. You cannot provide a service that is not effective in affording equal opportunity. I brought this attention of the board and to the county attorney. I submitted my speech in advance last meeting. I asked for feedback, but during public speaking, it's extremely difficult for me with my mental health, especially when others are given extended time and I'm interrupted. So I asked for accommodations. I also view my participation to include email contacts with my legislator, and it is my right to receive feedback. This was his response. Bill, I read your emails thoroughly every day. I no longer respond because your self-proclaimed PSTV mental illness issues. I do not respond because I do not want to exacerbate or increase any anxiety you experience when and if I disagree with you. It does not mean that I am ignoring you. My silence is out of compassion. Sincerely, Kevin Akers. I reported this to the Department of Justice. Mr. Akers won't speak to me due to my disability, and he insults my disability with a self-proclaimed title. He's laughing. I know I'm out of time, so in closing, actually I'm not out of time, I have plenty of time. Let me just say it's time up for you guys. The unethical way this county government functions, the lies, the corruption, the public retaliation by employees must stop. It's an election year. How is it that someone like me could run for your seat, Mr. Akers? This is time for a change, don't you think so? I usually end my comments with saying hello to Margaret. But again, everything else with this county, I'd like to say hello to Mr. Arquette. You're the next big star on The Price is Right.
Come on down.
Point of order.
Sorry, I apologize.
There should be no
I'm done.
comment.
I have 24 seconds left.
Who just said to calm down? Come on down. What was it? To you?
Yes, sir.
That's your warning. One more out.
Really, no.
I'm gonna have the sheriff remove you. You
Really,
understand?
no.
You understand?
Yes, I do, sir.
Thank you. Okay, number 2. Barry Skelly.
I'm gonna start the timer here. Good evening, Mr. Chairman. I do not pound on that gavel like you do for me and others as aggressively as you do. Because I also have PTSD. It is noticed in the community that you are pounding on that gavel when my time's up. So I've just wasted time. So I'm gonna start my 5 minutes now. It's hostile. I'm not the only one who perceives it to be excessive for some of us that come up here and speak. You offer others much more time. The department had Heather Rand over here for 30 minutes 30 to 40. This is a biased and unethical body. Every single one of you should be unseated in 2022, if not stepping down for crimes. You get your due process and the lies. And now you've targeted people with PTSD. That means you've targeted veterans, Mr. Akers. Thanks a lot. I served my country honorably. Desert Storm. So I can't speak to you. I can't speak to Mr. Lightfoot because I have legal issues with the Department of Social Services that were based on lies. Mr. Lightfoot, Jim Reagan, a special session was leaked in Ogdensburg to a constituent. Where did they get that information? You leaked and leaked and leaked. The person who created the resolution recused herself when Margaret Haggart was the one who said she wouldn't vote on anything DSS. I mean, how unethical as it is, and magically her husband gets what? A promotion? He's pointed to some bench. Would you take your seat? Switch chairs? I don't know. I need Mary Rain to, get in touch with her on a little feedback from all of that. This body has such disdain for the First Amendment. It's unbelievable. Last month, we had no more promotion. Who said this is promotion we bring to you in front of this body? Who said that? You? It's not promotion. This is serious. Rita, don't invite me to your your fundraisers. Been there, done that with Veterans for Children's Rescue 4 years ago. That's a Navy SEAL, Benghazi survivor, whose child was trafficked here in America. He went through his struggles too. Can you imagine with his experience and training? Been there. You want to do something? I've come here how many months for mandatory online safety? 15 people, Margaret Haggard, what can the county do for COVID? What can we do? What can we do? How can we reach out to the state? That is something 15 of you could do. So Rita, no, you want to donate to me. I am the face of human trafficking in this county. I brought it here. I've raised awareness. Anyone wants to go to the Wesleyan Church this Saturday with women, they're having discussion on child trafficking. I'll be there. I'll see how really informed that they are. Ruth, DSS, or county administrator, pick one. How you doing with my daughter? How's it going? What do you need to present to me tonight? You can bring it up right here in front of the public. I got Jim and Joe, your constituents, your reach. One side of the story, Joe tells me, have how many people have come here and told you theirs. Biased. Acres, PTSD, veterans, not allowed to speak. No accommodations for us. Margaret Haggard. You're just an ethical mess. District 5, who represents District 5? Governor PD will only accept tips on a missing person. We have one missing person in St. Lawrence County, and that happens to be my group. They will only accept tips through Facebook Messenger. They've disclosed a person's, they violated HIPAA. Go read it. Who is editing this? Who's in charge of this debacle? And then the way they treated her in the hospital. And who signed off on her? Did you sign off on her treatment? No, the wrong person. You're responsible. Now, the county has decided that they're going to involve themselves in a civil case in Florida with me. Courts are open in Florida, and guess what? We're going on a trip. And you're going to answer to the lies under sworn testimony in a different environment. Ruth.
Ma'am, calm down. Take a breath.
Clown show. I'll take what you have to give me, Ruth.
Kevin
Now,
Gary?
I'm leaving.
3 years ago, on the 3rd of December, 2018, I addressed this body. I would like to read an excerpt from those remarks. I would like to follow up on some remarks made to the legislature last month by the mother of 2 children who were taken from her 7 months ago by Child Protective Services of the Department of Social Services. I would like to call to the board's attention the fact that the oldest boy, who is 7 years old, was first placed in a foster home and then placed in the Ogdensburg Psychiatric Center's Children Youth Services facility, where he was prescribed 4 psychotropic drugs: clonidine for attention deficit hyperactivity disorder, Concerta also for ADHD, Zyprexa for psychosis, and trazodone for insomnia. Specifically regarding trazodone, I wish to point out that according to the prescribing information sheet published by Teva, the company that makes the drug, which is posted on the website of the National Institutes of Health, trazodone is not approved for pediatric use. On the very first page of the prescribing information sheet, there is a boxed warning regarding the increased risk of suicidal thinking and behavior in children, adolescents, and young adults taking antidepressants. Trazodone is not approved for use in pediatric patients. The warning is repeated. Safety and effectiveness in the pediatric population have not been established. Trazodone hydrochloride should not be used in children or adolescents. I know that the legislators rely on the expertise of the Department of Social Services, but it is wrong that county funds should be used to take children from their mothers and to put them into psychiatric institutions where they are prescribed powerful psychotropic drugs that are likely damaging to their physiological and psychological well-being now and in the future. I urge the legislators to inform themselves personally about the current national crisis in child protective services. End of excerpt. Attorney Matthew M. Cummings has examined this issue at length in a paper in the Boston College Journal of Law and Social Justice titled "Sedating Forgotten Children: How Unnecessary Psychotropic Medication Endangers Foster Children's Rights and Health." In November 2018, a reporter for the Watertown Daily Times wrote a story about the situation of this woman and her 2 children. It was a very well-written and informative story based on an interview the reporter did with the mother of the children. But the story never appeared in the Watertown Daily Times. Someone who did not want the problems of DSS to come to the public's attention was influential enough and powerful enough to have the story killed at the Watertown Daily Times. Instead, another story, which was originally meant to be a sidebar to the longer story, and which was written by the same reporter, was published in December 2018, based on an interview with the then Commissioner of DSS, without mentioning the case of the mother and her children. It is most unfortunate that even after they had been alerted to the situation at DSS, the legislators waited for over 2 years before they decided to look into the problems of the department. And then only because over the years the complaints had swelled to such a chorus, they could no longer be ignored, especially since the law firm had gotten involved.
Next, David Smith.
What do you read? All right. I apologize, sir. Before I start, I have in writing. I'll read it out loud. I, Amanda Whitmarsh, have been called away on a personal matter in Messina. Friend of mine, and will be unable to attend tonight's public meeting. As such, I yield my 5-minute allotted time to Mr. David Smith. Okay, so it shouldn't take anywhere near 10 minutes, ladies and gentlemen. Hold on there. I'd like to start with a moment of silence for all the Americans, past, present, and future, that we have lost, and unfortunately going into the flu, influenza A, B, H1N1, yada, yada, yada. We're in for a rough winter. So, just a moment of silence. They're still with us. Maybe in the hereafter, but I'll put my hand in family Bible and attest there is a hereafter. Good evening, ladies and gentlemen, and all others gathered here tonight to our monthly St. Lawrence County Board of Legislators meeting. I would like to personally thank all of you from my Leo piety to yours, and wish everyone a Merry Christmas and Happy New Year. I appear before you tonight in good faith and with a genuine concern for all our children's safety, welfare, emotional, and psychological development. It is my intent to apprise the St. Lawrence County Board of Legislators with as much available information as possible. So any future resolutions concerning the ongoing criminal investigation of CPS can be informative ones. Our democratic form of government is like a three-sided coin. Legislative branch, executive branch, judicial branch. The judicial branch speaks for itself. The law of the land. Now, I'm not a lawyer, so if there's an attorney in the room, you feel free to correct me. Is federal law. Anything that has gone to the Supreme Court is the law of the land. We live in the land of the free because of the brave. And you say coins don't have three sides? They do. Well, heads I win, tails you lose. Right? Two sides. No. Put it on its edge. Straight lines do form circles. Now I would like to read a January 21st, 2020 inquiry to the St. Lawrence County Board of Legislators and an affidavit I sent to the New York State Attorney General Public Integrity Board on or about December 21st, 2018. This is the inquiry. In light of the homicide last summer in Governor, I have concerns with the safety and welfare of our children when it comes to investigations of alleged child abuse / neglect presently being conducted by DSS. I was recently advised by a New York State investigator from Raybrook in major crimes, law enforcement works with DSS, which would imply a conflict of interest if law enforcement declines to investigate a counter complaint against DSS. You gotta breathe. Where was I?
DSS.
Upon information and belief, a primary role of law enforcement is to protect and serve the public, which doesn't mean to turn a blind eye to issues regarding DSS investigations. It is my collective hope St. Lawrence County Board of Legislators can address my concerns or at least point me in the right direction. Now, I have reason to believe that information has been withheld from y'all. Is it 10 minutes already?
5 minutes.
Okay, thank you. Now, the affidavit.
You gotta stop, this is good 5 minutes.
I don't get my own 5, my, this is what Marcia's?
No.
All right. Well, you all have a Merry Christmas. And when you're gathered by that Christmas tree this year, count your blessings. If there's a silver lining in this COVID-19, the most important thing to me is my family. I'm a 58-year-old grandfather, and I will do just about anything for not only my grandchildren, but everyone's grandchildren. And again, I apologize for come on down.
Courtney? Got some? Yeah.
Good evening. I stand in front of you tonight disappointed by how you handled last month's resolution to cease the future placement of foster children in DSS homes. You, the legislators of St. Lawrence County, are elected and paid to represent your constituents. However, you ignored a petition that carried 25% more votes than the petition that was created against it, and dismissed the North Country Now poll that almost twice as many voters thought it was inappropriate for DSS employees to foster than not. All of you justified not voting for this resolution because you did not wish to disrupt current placements. However, this was foolish on your part because this was addressing future placements and had no effect on current. According to Ms. Rand at DSS during the services committee meeting, we have 312 kids in foster care, 99 in traditional foster care settings. Remember this number for later. 13 in institutions, 15 home on trial basis, 4 in independent living, 1 in other, and 180 in kinship. We know that we have 190 foster homes in St. Lawrence County. This includes 109 DSS and 86 in foster and futures. Ms. Rand noted that 2/3 of the DSS's 109 are kinship homes, and the remaining 1/3 are traditional. This brings the non-kinship number of homes to around 122. According to these numbers, there are 99 traditional non-kinship children placed in foster care in St. Lawrence County. And these are placed in the 122 non-kinship homes. That's an average of 1.23 homes available per child. I would not consider this a shortage by any means. Additionally, it's been reported that 3% of St. Lawrence County's foster children are placed in the homes of DSM's employees, meaning there's only 6 employees fostering 10 children, 2 of which are kinship. This reporting is slightly skewed as it calculates the total number in care over the total number of children in DSS homes. So that's 10 divided by 312, 3%. However, if you take kinship placements out of this equation, because there's no alleged conflict in kinship placements, that number changes to 8 divided by 99, or 8%. That means approximately 1 out of every 12 children in DSS foster care are placed in the home of a DSS foster employee, a DSS employee. Not 1 out of 33, which was previously reported to us. This does not even take into account the numbers of foster and futures employees who foster. Additionally, we know that New York State says that there's 14% of children who come into care are under the age of 2. Yet there's a large number of DSS employees who are taking placements of these children upon birth. Ms. Rand previously reported that both of the employees within CPS foster children, which they acquired at birth. In addition, we also know that there's another DSS employee who acquired one of her placements at birth, and the other 3 at ages 1, 4, and 6. It appears that the odds are in the favor of DSS employees when it comes to taking placements of younger children. Ms. Rand also reported that there's no case crossover for employees who serve as foster parents, ensuring this board that impropriety did not exist in these situations, because within the Connex system, it's marked as sensitive. You may or may not see how untrue that is, depending on how many comments we get through tonight. Child continues to be contacted by not only families in crisis, but also counselors, service providers, and DSS employees who do not wish to go down with the sinking ship. The atmosphere at DSS is being described to us as dog eat dog, and caseworkers pointing fingers at each other, saying, "You are the ones that got us into this mess." I continue to urge anyone who wants to be part of this solution to please feel free to reach out to our organization. Child continues to fight
The sound is gone.
I sent a message. They're working on the sound and they paused the speaker just so you all know. Okay.
Thank you, Nicole.
Legislative body.
Well, actually, I'll just sit here.
Thank you, Dylan.
We should. Okay.
There are so many of us that got into this job to help people, but our county legislators refuse to provide the funding required to actually make an impact. We are constantly trying to do more with less. The kids are dying in our county because no one is helping. Please help. We need a hero, and I wish I could be that person, but like so many others, I have a family that counts on my income to survive. However, I can't sit by in silence and not tell the truth. I appreciate your efforts on behalf of all the kids and families in crisis in St. Lawrence County. Sincerely, a DSS staffer who cares. Handwritten on here says so many of us are too scared to talk. So this is not the only one we've got, but this is the only one I could read because I had no information, but your employees are starting to meet each other. Second thing, past and present employees are posting on Facebook, and I'll read you one of these. Jesus F word, please, people are so ignorant. These children are sexually offending and abusing each other. There's always three sides to every story. Yes, of course, there are issues everywhere, but make sure you know the whole GD story. Most of you would kill yourselves if you ever had the effing balls to be an investigative caseworker in CPS. You pathetic F words have no idea. That CPS employee hadn't worked for you guys for a year, but had a lot of knowledge, and then she blew up my Facebook Messenger after that. Sexually harassing me for probably about 4 hours. So, should be the proud of your employees. At least they spelled the F word right.
Jessica Foster and Tim Aldis. So, we'll touch that.
Good evening. Our names are Jessica Foster and Tim Aldis. We own a gas station convenience store. We are open 7 days a week, 14 hours a day. Our house is 10 feet away from our store. My co-parenting with my ex was going very smoothly, and we were getting along with each other for our kids' sake. That was until he got with his present girlfriend, who is a St. Lawrence County DSS caseworker. Since they got together, I've been taken to family court for a custody battle in which my ex's girlfriend filled out the paperwork and he signed. It was a 3-month battle and 3 hearings for him to finally settle for less than what I had to offer. He was originally going for full custody, but settled for 8 days a month. After the custody battle, I have been turned into CPS 3 times. The first 2 cases, I had the same caseworker. The second turn in, my girl's father was not happy about it because the first case was unfounded. The second case was also unfounded. The caseworker that was assigned even offered me her own kids as a babysitter and said that he won't stop. So if you get a babysitter, you will have nothing to complain about. December 2020 came and I was getting messages from a friend who overheard in a bar that we were being turned in again. Our exes were talking to each other and building a case against us. My ex's girlfriend and Tim's ex-mother-in-law, who also was a St. Lawrence County DSS employee, but is out for medical, were questioning both of our exes. April 27th, the DSS caseworker showed up and told us we had to report a child abuse on April 26th, which supposedly happened in our store. My sister was at the store at the time of the incident happened and was a witness for us. We also have video recording, and never once was that asked for. May 10th, we were turned in that Tim grabbed my youngest daughter's arm for trying to grab a snack, which left a bruise on her arm. Again, this supposedly happened in the store, and again, no video was requested. I got the call from the caseworker that I had to come up with a safety plan, and I was not allowed to leave my girls with Tim alone under any circumstance. May 13th, the caseworker and her supervisor came to our house for a home visit. May 14th was the last time I heard from the caseworker. We didn't hear anything more from DSS. We thought our case was closed. That was until July 23rd, when our caseworker showed up off the record and said I was hitting my girls 30 minutes prior. We told her to leave and not to come back unless she had the troopers with her. July 29th, we were served papers at 6:30 p.m. for court the next day at 10 a.m. We had 16 hours to retain a lawyer. If we did not have a lawyer at our court hearing, my ex would have gotten custody of our girls, and mine and Tim's baby would have been placed into foster care. Since court hearing on July 30th, I was ordered to live at my dad's, and my children were not allowed on our property. Tim is not allowed to be around our son unsupervised. Tim is basically working the store alone with me not allowed to be there with our son. DSS said our supervisors had to go through a 2-hour orientation. We sent over the list of people we wanted to supervise the day after our first hearing. We sent that list several times with no response from DSS. Our caseworker came to my dad's and asked for the list of people we wanted to supervise, and I asked her how many times do we have to send this list. She left my dad's, and an hour later I got an email from her that everyone on our list was instantly approved. I didn't even send the list over to her yet. It took 3 months for them to approve our supervisors, and that was without going through the orientation they said that they had to go through. Tim finally got his first supervised visit on Thanksgiving. Our son was 5 months old the day we moved to my dad's and is now 9 months old. On top of it all of this, Tim and I both have to go to parenting classes, have mental health evaluations, drug and alcohol screening, and I need to be evaluated by the renewal house because Tim supposedly abuses me. The reason we're going through this living hell is because the caseworker assigned to our case is my ex's girlfriend's best friend. Judge Morris and DSS refused to acknowledge the major conflict of interest.
Next, we have a video. Erica Porter.
Be evaluated by the renewal house because
my name is Erica Porter and I'm from Watertown, New York.
The reason we're
Due to
going through this
safety
living hell is
concerns
because the
surrounding
caseworker
COVID-19
assigned to our
protocols, I
case is
couldn't
my
join you in
ex's
person
girlfriend's
today.
best friend.
To me, it makes more of a
Judge
statement to
Morris
appear
and
in front
DSS
of
refused to
you. I want
acknowledge
you to
the
be able to look a mother. About misconduct. I'm beginning to question. My name is Erica Porter and I'm from Watertown, New York. Due to safety concerns surrounding COVID-19 protocols, I couldn't join you in person today. To me, it makes more of a statement to appear in front of you. I want you to be able to look a mother like me in the eyes while I talk about the perpetual neglect children are experiencing at the hands of St. Lawrence County DSS if you're going to sit back and allow it to happen. I'm aware that as the Board of Legislators, you have called upon the Bonadio Group to complete an investigation of St. Lawrence County DSS. Despite numerous messages, they have yet to reach out to me or anyone else to take our complaints about misconduct. I'm beginning to question the legitimacy of this investigation and your commitment as a legislative body in addressing constituent concerns. A poll from North Country Now cited that more than half of constituents in St. Lawrence County supported the resolution that would stop new placements of children into foster homes of DSS employees. It's evident in your handling of ethical concerns within St. Lawrence County DSS and your refusal to vote based on constituent interests that you remain neutral when concerned with families in and around St. Lawrence County that are being unfairly ripped apart or kept apart. I'm also aware that you have the power to oversee the work of the Social Services Department in St. Lawrence County. In fact, I know that you are able to do much more than you have done. I'm also aware that since you first heard me speak 4 months ago, nothing has changed. It doesn't matter if I'm from this county or the next one. It shouldn't matter if I'm even a resident of this planet. The children I beg you every month to help are St. Lawrence County children, and they need you. They deserve better than the circumstances they have been given. These children are 7, 8, 9, and 10 years old. The 7-year-old has been in foster care for 64% of his life, not because the biological parents have given up on him, but because the biological parents have consented to his adoption by myself and my husband. This child and his 3 siblings linger in foster care because St. Lawrence County DSS refuses to allow these 4 siblings to be adopted by 2 caring, duly certified teachers with unblemished reputations and 175 training hours of trauma-informed parenting. Something that should be so painless as allowing these children a permanent home together has been thwarted countless times by caseworkers that claim to have the children's best interests at heart, yet consistently fail to do the right thing. Christmas is supposed to be filled with love and laughter. That's exactly what you would have found if you had stepped into our home last year. I filled our living room with gifts for our foster children's first Christmas with us, and our foster daughter was overjoyed that she was finally on the nice list. Those were her words to me. It was heartwarming. It was heartbreaking. The look of delight on her face as she opened every present, how she gushed over each individual piece of candy in her stocking. It's something that I'll never forget, and it's a feeling that I'll never take for granted, especially since St. Lawrence County DSS may have robbed that child and my family from ever experiencing it again. This year, that same child will be spending Christmas in an institution. Not for lack of an available home with the resources to support her, as we've called on DSS and CHJC time and time again to just send her home to us. We've spent thousands of dollars in legal fees, filing endless paperwork and motions to have the children returned to us. We've sent letters to the agency. We've begged and cried and pleaded for them to do the right thing so this child can sleep in her own bed, in her own home, where she's wanted and needed and missed and so loved. We've even filed for custody of her and her brothers in family court. Why would these agencies rather ship an 8-year-old child off to a residential facility mere weeks before the holidays, rather than admit they were wrong in taking our children away? I'm saddened that my husband and I have tirelessly campaigned for these children to be returned to our home after they were unfairly taken in August. All of these attempts have fallen on deaf ears here in St. Lawrence County. I'm so saddened to know that getting vulnerable children home for the holidays is not a priority when you sit on the board with direct oversight of DSS and its misconduct. It seems to me that St. Lawrence County DSS caseworkers, the Board of Legislators, Judge Morris, and countless other agents in St. Lawrence County are willing to sacrifice the permanency of 4 vulnerable, traumatized children to save face, to cover something up. I'm not sure how you all truly believe that that's what's best for children. It's certainly not what's best for my 8-year-old little girl who will spend Christmas morning in a residential treatment facility, a stark contrast to the smiles and laughter and love and warmth she experienced last year. Please help us help our children. We want them home, and these children deserve to be home with us on Christmas morning. Every child deserves to be home with their family on Christmas. Thank you.
Hi, this is Dottie Spears. At your Services Committee on November 15th, Heather Rand reported that the files of foster children placed with DSS employees were marked sensitive. I am going to read an email from a DSS employee foster parent to the Attorney for Child, or AFC, and was shared with my attorney because the AFC was concerned. The AFC received this email on Saturday, November 6th, and he reached out to my attorney on the 7th. There must be something in this email to cause the AFC to be alarmed to be sharing this on the weekend. Here is the email. Hello, AFC. I hope you are doing well. I am reaching out to you out of concern regarding 2 of our foster children, my grandson and sibling. I was made aware by the caseworker for my grandson that the home study came back favorable for Grandma and Grandpa who reside in Tennessee. I have several concerns that I wanted to discuss with you and thought an email might be easier, but if you would like to discuss further, please feel free to give me a call at and her phone number. The first concern I have is that sibling and my grandson have a very strong bond, and I believe that this should be a major consideration when looking at permanency and Grandma's custody petition. These 2 boys are half-brothers and have been placed together since my grandson was born. Sibling is very aware that this is his brother, and the sibling bond is very strong. Sibling has been freed for adoption, and the adoption paperwork is currently in process as I type this email. It is my understanding that sibling has significant rights to have a relationship with his brother. I have been doing research, and it looks like Social Services Law Section 409 includes half-siblings for purpose of placement and permanency, and shows that even though one child has been surrendered, they are still considered siblings for purposes for placement and permanency. I have Also read further OCFS regulations that provide for siblings and half-siblings to be placed together whenever possible unless such placement is not in the best interest of the children. In this instance, the boys have a strong bond and there is zero evidence to prove that placement together would be contrary to the health, safety, or welfare for the boys. I am very concerned that if they are separated, this will be detrimental to sibling and his mental well-being. Sibling gets very concerned when his brother is gone on visits and watches for him to return safely every day. He typically greets him at the door with a hug, kiss, and says, "I miss you so much. I'm glad you are home." Another concern is if these boys are separated, they will need to have sibling visits. How will this be facilitated considering the age of the children and the distance that would be placed between them should placement with grandma happen? I am very aware that grandma stated that she would take sibling as well. However, she has no relation to sibling, has had zero contact with him, and sibling has been with our family for over 2 years, forming a bond with us. It is my understanding that we now have legal standing with sibling, and we already started the adoption proceedings for him. We have retained the services of a law firm to handle this matter. Another concern that I have is grandma's intention with the baby, should he be placed in her care and custody. I have no idea if the visitation supervisor was supposed to tell me, but he voiced his concerns after returning the baby to me one day. That father, the bio father, told him that he's not worried about the baby being moved to Tennessee because his mother told him that when she gets placement of the baby, he will move down there, and after 6 months, she will just give him back the baby. This statement is very alarming considering the magnitude of biological father's mental illness and his history with showing aggression and his inability to provide care for the baby. The permanency hearing report lays out these concerns. Thank you for your time in hearing my concerns for these boys. If you have any questions or want to discuss further, please reach out to me. I would be willing to provide you with any information I can. My main priority is to protect the relationship between these brothers and keep them together if at all possible. Thank you. DSS employee and her husband. Now my questions. Why is she aware the home study came back favorable? Question 2, why was the half-sibling told he is my grandson's brother? Question 3, how is the DSS employee foster mother aware how the boys interact after visitation so descriptively when she is at work? Number 4, state OCFS also feels that she is trying to start her family over since her 2 biological children are adults. Question 5, I may have no relationship with half-sibling, but she has no relation to my grandson and is using the half-sibling to keep my grandson, as you could hear from this letter. Number 6, why is the visitation supervisor talking to this foster mother about confidential DSS information? Number 7, this foster mother is also liable for defamation of character for this info she wrote. Question 8, why does she know what is in the permanency report concerning my son's mental health as a foster parent when she receives notification only of upcoming hearings? Again, most likely because she is a DSS employee as well as my grandson's foster mother, co-workers are sharing confidential information. Thank you.
Guess that's it. Public participation.
Unless there's anyone else.
So, with that, we'll move on to resolutions. Ms. Carr.
Mr. Chairman, can you hear me? Yes. Okay. I have a resolution authorizing the chair to sign a contract with the New York State Office of Homeland Security for a fiscal year 21 emergency management performance grant. And I move this resolution.
Seconded by Mr. Burke. Any discussion? No discussion. All in favor? Aye. Opposed? Carried. Ms. Kern.
Mr. Chair, thank you. I have a resolution authorizing the chair to sign a contract with the New York State Division of Homeland Security and Emergency Services Office of Interoperable and Emergency Communications for a fiscal year 20 statewide interoperable communications formula grant and modifying the 2021 budget for emergency services. Move this resolution.
Seconded by Mr. Denisha, and discussion? Any discussion, no discussion? Roll call vote, Kelly?
Sheridan,
Yes.
Smithers,
Yes.
Denisha,
Yes.
Perkins, Akers,
Yes.
Bay,
Yes.
Haggard,
Yes.
Fiaco,
Yes.
Burke,
Yes.
Arquette,
Yes.
Terminelli,
Yes.
Curran,
Yes.
Reagan,
Yes.
Forsythe,
Yes.
Lightfoot,
Yes.
14 yes, 1 absent.
Motion carries. Mr. Lightfoot?
More here from Mr.
Is there another one?
More. Actually,
Sorry. Sorry about that, Bill.
That's okay.
That's
I'll-
mine.
we'll not-
You have your resolution?
the old one. That's an order. Yeah. So the one authorizing the chair signing the amended contract? Page 3, where it's all correct.
It's with
all correct. That's okay. Okay, Mr. Kern, go ahead. Go ahead, Frida.
Number 9.
Page 3.
Can she hear? Can she hear us?
I don't think she hears.
I can hear you, but on my copy that you sent me, I have 1 and 2, and then it goes to Mr. Lightfoot.
Same thing.
Okay, so which one do you want me to start on, Mr. Chair?
Number 3.
Do you just want me to go through and read my resolutions?
Yes.
Yes, you do, Ruth?
Yes. Yes.
Okay. All right. So then we'll go to what is number 9 on mine. Sorry, Mr. Chair, I have a resolution authorizing the chair to sign an amended contract.
Wait, hold on, wait just a second. Go ahead.
I was going by the paper copy, and
Of resolution.
that's what I said what I did. I didn't start well into it. I wasn't going by the one on the screen. I'm glad to if you want me to.
I'm going by the paper. We could just go
Or the resolution.
on the resolutions, and instead of Lightfoot all the way through from the second one down on page 2, instead of Lightfoot, it'll read Kern all the way down, and again, all on page 3, Kern all the way down until we get to, well, all the way to the bottom.
Page 22.
And then the first time we had somebody other than Mr. Kern, would be Mr. Reagan, Forsythe, and the rest of us who were all on one resolution. Is that okay?
Whatever you say.
Okay, go ahead. You'll just do everything.
Keep going in order.
Yep.
In order.
In order, go right down through it. Okay, so now, Ms. Kern, go ahead with your resolution.
All right. So I have a resolution authorizing the chair to sign an amended contract with New York State Indigent Legal Services for the provision of funding associated.
No.
Can you go back to page 3? Or number three,
I-
page 6.
So,
So, point of order, on the electronic, I don't know if the paper is the same. The first two resolutions is Ms. Curran, and if the public is actually seeing the next resolution is by Mr. Lightfoot, probably should proceed in that order.
The resolutions that public would see is this, is the
And
resolution.
is that the resolutions that the public would see on
Yeah.
our county website?
Yes, they would not see this is just to read along. They would not see the chair's agenda. My mistake, I wrote Mr. Lightfoot, and it should have been Rita on that first page.
Okay, I apologize.
So that's where the error is. They're Rita's, fell under Rita's committee.
so number 3, page 6 is really me.
Yes, all the way down through.
Okay.
There you go.
All right. Sorry, I apologize, but I have what they sent me. Okay, so number 3, then I have a resolution authorizing the chair to sign a contract with Entredo Life and Safety Solutions for corporation for 911 systems and professional services, and I move that resolution.
Seconded by Mr. Burke. All in favor? Go ahead with discussion. Any discussion? No discussion? All in favor? Opposed?
Aye.
Carried. Go ahead, Ms. Kern.
I have a resolution modifying the 2021 budget for the Planning Office for Community Development Block Grant, the CDBG Coronavirus Aid Relief and Economic Security Act CARES funds, and I move this resolution.
Seconded by Mr. Burke. Any discussion? No discussion. Roll call, Kelly?
Smithers,
Yes.
Denisha,
Yes.
Akers,
Yes.
Fay,
Yes.
Haggard,
Yes.
Piaco,
Yes.
Burke,
Yes.
Arquette,
Yes.
Terminelli,
Yes.
Curran,
Yes.
Reagan,
Yes.
Forsythe,
Yes.
Lightfoot,
Yes.
Sheridan,
Yes.
14 yes, 1 absent.
Resolution carries. Ms. Kern?
Thank you, Mr. Chair. I have a resolution authorizing the chair to sign a sub-recipient agreement with the North Country Housing Council, Inc. for the delivery of the SLC CARES Housing Rehabilitation Program, and I move that resolution.
Seconded by Mr. Burke. Any discussion? All in favor?
Aye.
Opposed? Carried. Ms. Kern?
I thank you. I have a resolution authorizing the chair to sign a memorandum of understanding with the Deason Criminal Justice Reform Center at Southern Methodist University, Dedman School of Law, to participate in the gauging improvement in the defense efforts and outcomes in New York State Gideon Project. And I move this resolution.
Seconded by Mr. Dave Denisha. No. Mr. Dave Forsythe. Sorry about that. Well, Denisha's right next to you.
He is. Pretty close.
Okay. Any discussion? No discussion? All in favor?
Aye.
Opposed? Carried. Ms. Kern?
I have a resolution authorizing the chair to sign a contract with the New York State Division of Criminal Justice Services to accept the Aid to Defense grant for October 1, 2019 through September 30, 2020. And I move this resolution.
Seconded by Mr. Dave Forsythe. And any discussion? No discussion? All in favor? Opposed? Carried. Ms. Kern?
I have a resolution authorizing the chair to sign a contract for the New York State Division of Criminal Justice Services to accept the Aid to Defense grant for April 1, 2021 through March 31st, 2022, and I move this resolution.
Seconded by Mr. Denisha. All in favor? Oh, no, discussion. Any discussion on that? No discussion? All in favor? Opposed? Carried. Ms. Kern?
Thank you. I have a resolution authorizing the chair to sign an amended contract with the New York State Indigent Legal Services for the provision of funding associated with the implementation of the Senate Bill S.8114 and Assembly Bill A10706, an act to amend the county law, the executive law, and the state finance law in relation to indigent defense services, and I move that resolution.
Seconded by Mr. Burke. Any discussion? All in favor?
Aye.
Opposed?
Aye.
Carried. Ms. Curran.
Thank you. I have a resolution authorizing the chair to sign a contract with NTS Data Services for renewing voter registration, signature digitization, full document imaging, electronic reporting, and interface messaging system maintenance and support the Board of Elections, and I move this resolution.
Seconded by Mr. Forsythe. Any discussion? No discussion, all in favor?
Aye.
Opposed? Carried. Ms. Curran.
I have a resolution authorizing the chair to sign a contract with Infotech Research Group for IT research and advisory services to comply with the cybersecurity regulations for the Board of Elections. And I move this resolution.
Seconded by Mr. Fay. Any discussion? No discussion, all in favor?
Aye.
Any opposed? Carried. Ms. Curran.
I have a resolution authorizing the chair to contract with Network Experts of New York. Stop it. For network segmentation in order to comply with the cybersecurity regulations for the Board of Elections, and I move this resolution.
Seconded by Mr. Akers. Any discussion? All in favor?
Aye.
Opposed? Carried. Ms. Curran.
I have a resolution authorizing the chair to sign an agreement with Language Line Services, Inc. to provide interpretation services in St. Lawrence County, and I move this resolution.
Seconded by Mr. Forsythe. Any discussion? No discussion, all in favor?
Aye.
Opposed? Carried. Ms. Curran.
I have a resolution authorizing the chair to sign a contract with Burnham Benefit Advisory for healthcare consulting and related actuarial services, and I move this resolution.
Seconded by Mr. Lightfoot and Akers. Any discussion? All in favor?
Aye.
Opposed? Carried. Ms. Curran.
Thank you, Mr. Chair. I have a resolution authorizing the chair to sign a contract with Public Safety Psychology, PLLC, for psychological evaluations for police officers and deputies, and I move this resolution.
Seconded by Mr. Forsythe. Discussion? No discussion, all in favor? Opposed? Carried. Ms. Curran.
Thank you. I have a resolution authorizing the chair to sign a contract for a fiscal year 21 Operation Stone Garden Program grant from New York State Division of Homeland Security and modifying the 2021 budget for the Sheriff's Office, and I move this resolution. Stop it.
Mr. Reagan is the second, and discussion by anyone? No discussion? No roll call vote?
Denisha,
Yes.
Akers?
Yes.
Fay,
Yes.
Haggard,
Yes.
Piaco,
Yes.
Burke,
Yes.
Arquette,
Yes.
Terminelli,
Yes.
Curran,
Yes.
Reagan,
Yes.
Forsythe,
Yes.
Lightfoot,
Yes.
Sheridan,
Yes.
Smithers,
Yes.
14 yes, 1 absent.
Carries. Ms. Curran.
Thank you. I have a resolution adopted. Is that one Lightfoot's?
Yes, that's your resolution, go ahead.
Okay.
Adopting proposed local law D number,
Right. That's mine.
yes,
Okay. Adopting proposed local law D for the year 2021, reapportioning 15 legislative districts in St. Lawrence County, and I move this resolution.
okay, seconded by Mr. Nation. All in favor?
Aye.
Wait a minute, did I say discussion? No discussion, I haven't asked for discussion. Any discussion? No discussion, all in favor?
Aye.
Opposed, carried. Mr. Reagan.
I have a resolution, the St. Lawrence County Board of Legislators calls upon Governor Catherine Hochul to remember how the people of Ogdensburg and St. Lawrence County helped New York State and reconsider the decision to close the Ogdensburg Correctional Facility, and I move this resolution.
Second by Mr. Smithers and Mr. Forsythe and Mr. Akers and Ms. Kern. And any discussion? Go ahead, Mr. Forsythe.
Mr. Chair, thank you. If ever, you always wonder where these end up going, you know, who gets to read them, whatever. But if ever the governor is gonna read one, I hope she reads this. This is gonna be detrimental to the city of Ogdensburg, the county of St. Lawrence, businesses throughout St. Lawrence County. And I mentioned it at the original meeting, you know, the buildings that are gonna be left. I just look at the old barns and I just can't imagine what's gonna happen to this facility. So I urge someone to make sure she reads it and at least get some sort of effort. Thank you.
Mr. Reagan.
Thank you, Mr. Chairman. I just want to echo Mr. Forsythe's remarks, and what we're seeing is the Department of Corrections is moving swiftly to implement this by asking the correctional officers to fill out paperwork to indicate where they want to go, and they're beginning to transfer some of them out. If anyone wants to be of assistance in this time of need, now is the time for citizens across the county, businesses, local governments, and others who care about the future of the county to come forward and rally around Ogdensburg in our effort to protect these jobs and the staff of Ogdensburg Correctional. It's been shown, and I won't belabor all the points that have been made at previous meetings, but this is one of the most efficient, one of the most effective correctional facilities in the state. And, you know, while the state has a perfect right to downsize facilities, it really needs to take a look at what facilities it can close that will actually allow the state to redevelop the properties and sell the properties and create a net economic benefit. Downstate, there are a lot of prisons in which the community does not want them. The land they sit on has a high value, and if the state of New York were to close those facilities, they could be quickly redeveloped and actually put people to work and boost the economies of those areas. All they're going to do by closing Ogdensburg Correctional is to put more people out of work, close more businesses in St. Lawrence County, put more children into poverty, and create more socioeconomic woes for a county that has already suffered enough. So please, Governor Hochul, please reconsider this, mistake.
Thank you, Mr. Reagan. Any further discussion? All in favor of the resolution?
Aye.
Opposed? That's carried. Now, like,
Mr. Chairman, I offer a resolution setting the 2022 rates and authorizing the chair to sign contracts for early intervention services for the Public Health Department and move for its adoption.
seconded by Mr. Burke. Any discussion? All in favor?
Aye.
Opposed? Carried. Mr. Lightfoot.
Mr. Chairman, I offer a resolution authorizing the chair to sign a contract with James McGinnis and Associates Incorporated to provide billing processing software for the preschool program in the Public Health Department and move for its adoption.
Seconded by Mr. Fay. Any discussion? No discussion. All in favor?
Aye.
Opposed? Carried. Mr. Lightfoot.
Mr. Chairman, I offer a resolution authorizing the chair to sign a contract with Monroe County for morgue and laboratory services and move for its adoption.
Moved. And seconded by Mr. Akers. Discussion? No discussion? All in favor?
Aye.
Opposed? Carried. Mr. Lightfoot.
Mr. Chairman, I offer a resolution authorizing the chair to sign a contract with Our Lady of Lourdes Hospital and Twin Tier Pathology for morgue and laboratory services and move for its adoption.
Seconded by Mr. Smithers. Any discussion? No discussion? All in favor?
Aye.
Opposed? Carried. Mr. Lightfoot.
Mr. Chairman, I offer a resolution authorizing the chair to sign a contract for pharmacist services with Dr. Benjamin Gruda in the Public Health Department and move for its adoption.
Seconded by Mr. Akers. Any discussion? No discussion? All in favor?
Aye.
Opposed? Carried. Mr. Lightfoot.
Mr. Chairman, I offer a resolution authorizing the chair to sign a contract with Vineski and Company for Article 6 state aid processing for the Public Health Department and move for its adoption.
Seconded by Mr. Akers. Any discussion? No discussion, all in favor? Opposed? Carried. Lightfoot.
Mr. Chairman, I offer a resolution authorizing the chair to sign a contract with Jack Vineski CPA and Associates to prepare the ambulatory care healthcare facility, annual Medicaid, Medicare, and Article 28 cost reports for the Public Health Department for fiscal years 2022, 2023, and 2024, and move for its adoption.
Seconded by Mr. Forsythe. Any discussion? No discussion, all in favor?
Aye.
Opposed? Carried. Mr. Lightfoot.
And Mr. Chairman, I offer a resolution modifying the 2021 budget for community services for Epic Health Solutions LLC for improvements to billing practices and move for its adoption.
Seconded by Mr. Smithers. Any discussion? No discussion, roll call, Kelly?
Akers,
Yes.
Fay,
Yes.
Haggard,
Yes.
Piaco,
Yes.
Burke,
Yes.
Arquette,
Yes.
Terminelli,
Yes.
Curran,
Yes.
Reagan,
Yes.
Forsythe,
Yes.
Lightfoot,
Yes.
Sheridan,
Yes.
Smithers,
Yes.
Denisha,
Yes.
14 yes, 1 absent.
Resolution carries. Mr. Lightfoot.
Mr. Chairman, I offer a resolution modifying the 2021 budget for community services for training and travel expenses and modules for the electronic health record system and move for its adoption.
Seconded by Mr. Burke. Any discussion? No discussion, roll call, Kelly.
Hay,
Yes.
Haggard,
Yes.
Piaco,
Yes.
Burke,
Yes.
Arquette,
Yes.
Terminelli,
Yes.
Curran,
Yes.
Reagan,
Yes.
Forsythe,
Yes.
Lightfoot,
Yes.
Sheridan,
Yes.
Smithers,
Yes.
Denisha,
Yes.
Akers,
Yes.
14 yes, 1 absent.
Resolution carries. Mr. Lightfoot.
Mr. Chairman, I offer a resolution authorizing the chair to sign a purchase schedule with 1011 Group for the purchase and setup of a methadone module for the opioid treatment program and modifying the 2021 budget for community services and move for its adoption.
Second by Mr. Akers. Any discussion? No discussion. Roll call vote, Cal?
Rita has her hand up.
Thank you, Nicole. Yes, I would like to be added as a co-sponsor to that, please.
So noted.
Haggard,
Yes.
Piaco,
Yes.
Burke,
Yes.
Arquette,
Yes.
Terminelli,
Yes.
Curran,
Yes.
Reagan,
Yes.
Forsythe,
Yes.
Lightfoot,
Yes.
Sheridan,
Yes.
Smithers,
Yes.
Denisha,
Yes.
Akers,
Yes.
Fay,
Yes.
14 yes, 1 absent.
Resolution carries. Mr. Lightfoot.
Mr. Chairman, I offer a resolution authorizing the chair to sign a participation agreement with North Wind Integrated Health Network, IPA Incorporated, for a behavioral healthcare collaborative for its adoption.
Seconded by Mr. Smithers. Any discussion? No discussion. All in favor?
Aye.
Opposed? Carried. Mr. Akers.
Mr. Chair, I offer a resolution authorizing the chair to sign a contract with Department of Judas, DPC, for professional engineering services for the design of a recycling transfer facility at the Ogdensburg Transfer Station and modifying the 2021 budget for solid waste. I move this resolution.
Seconded by legislator Denisha. Any discussion? No discussion. Roll call vote, Cal?
Piaco,
Yes.
Burke,
Yes.
Arquette,
Yes.
Terminelli,
Yes.
Curran,
Yes.
Reagan,
Yes.
Forsythe,
Yes.
Lightfoot,
Yes.
Sheridan,
Yes.
Smithers,
Yes.
Denisha,
Yes.
Akers,
Yes.
Fay,
Yes.
Haggard,
Yes.
14 yes, 1 absent.
Resolution carries. Mr. Akers.
Mr. Chairman, I offer a resolution authorizing the chair to sign a contract with Department of Judas, DPC, for consulting services for McCarthy Road Bridge over the west branch of St. Regis River. Excuse me, bin number 3358-370, and modifying the 2021 budget for the Department of Highways. I move this resolution.
Second by Mr. Smithers. Any discussion? No discussion. Roll call vote, Kelly?
Burke,
Yes.
Arquette,
Yes.
Terminelli,
Yes.
Curran,
Yes.
Yes.
Reagan, Forsythe,
Yes.
Lightfoot,
Yes.
Sheridan,
Yes.
Smithers,
Yes.
Denisha,
Yes.
Akers,
Yes.
Fay,
Yes.
Haggard,
Yes.
Piaco,
Yes.
14 yes, 1 absent.
Carried. Mr. Akers.
Mr. Chairman, I offer a resolution modifying the 2021 budget for the Department of Highways for overtime, machinery, and equipment rental, bridge supplies, and paving materials. I move this resolution.
Seconded by Mr. Lightfoot. Any discussion? The discussion on this is going to be, it needs to be a motion to change that last number from 14,722.25 to $85.25. That needs, we need a motion to change.
That we amend the figure to the correct amount.
What's that?
That's the next resolution.
Okay.
Yeah, that's the next
That's the
resolution.
next resolution,
Yeah.
not this one here?
We're still voting on the overtime budget for the highway.
Yeah.
We need a roll call vote for that. And then
Okay.
the next one needs to be amended.
On the charging tax items.
Yep.
Okay, then. Sorry about that. Okay, so roll call
Arquette,
Yes.
Terminelli,
Yes.
Curran,
Yes.
Reagan,
Yes.
Forsythe,
Yes.
Lightfoot,
Yes.
Sheridan,
vote. Yes.
Smithers,
Yes.
Denisha,
Yes.
Akers,
Yes.
Fay,
Yes.
Haggard,
Yes.
Piaco,
Yes.
Burke,
Yes.
14 yes, 1 absent.
Carried. Mr. Akers.
Mr. Chairman, I offer a resolution for the purpose of charging tax items. I move this resolution.
Second, Lightfoot. Any discussion?
Just need to be amended.
This is the one that needs to be amended. We're changing that last line, I think it's on page 3. On that resolution. From the $14,722.25 to $18,085.25. Okay, so
I move to amend the resolution for those correct
move
amounts.
be amended, seconded by Mr. Burke. All in favor of the amendment?
Aye.
Carried. Any opposed? All in favor, first. No opposed, no opposition, carried. Now in full amendment,
I move that we approve the amended resolution.
the amended resolution, and seconded by Mr. Lightfoot. We'll have a roll call, no, we don't need a roll call on this. All in favor?
Aye.
Opposed? Carried. Sorry for confusion. Mr. Akers.
Mr. Chairman, I offer a resolution adopting the mortgage tax report. I move this resolution.
Seconded by Mr. Burke. Any discussion? No discussion, all in favor?
Aye.
Opposed? Carried. Mr. Akers.
Mr. Chairman, I offer a resolution modifying the 2021 budget for the Treasurer's Office for taxes and county deforestation properties. I move this resolution.
Seconded by Mr. Smithers. Any discussion? No discussion, roll call vote.
Terminelli,
Yes.
Curran,
Yes.
Reagan,
Yes.
Forsythe,
Yeah.
Lightfoot,
Yes.
Sheridan,
Yes.
Smithers,
Yes.
Denisha,
Yes.
Akers,
Yes.
Fay,
Yes.
Haggard,
Yes.
Piaco,
Yes.
Burke,
Yes.
Arquette,
Yes.
14 yes, 1 absent.
Resolution carries. Mr. Akers.
Mr. Chairman, I offer a resolution establishing a departmental cash drawer for the Treasurer's Office for the collection of county real property taxes in the city of Augsburg. I move this resolution.
Seconded by Mr. Smithers. Any discussion? Are your hands up, Reed?
Only to second it.
Okay. Seconded also by Ms. Kern. Any discussion? All in favor?
Aye.
Opposed? Carried. Mr. Akers.
Mr. Chairman, I offer a resolution authorizing the chair to sign a contract with Legal File Software, Inc. for the case management of software related to the legal representation of the Department of Social Services and modifying the 2021 budget for social services. I move this resolution.
Seconded by Mr. Smithers. And Ms. Kern. Any discussion? No discussion? Roll call vote.
Curran,
Yes.
Reagan,
Yes.
Forsythe,
Yes.
Lightfoot,
Yes.
Sheridan,
Yes.
Smithers,
Yes.
Denisha,
Yes.
Akers,
Yes.
Fay,
Yes.
Haggard,
Yes.
Piyako,
Yes.
Burke,
Yes.
Arquette,
Yes.
Terminelli,
Yes.
14 yes, 1 absent.
Resolution carries. Mr. Akers.
Mr. Chairman, I offer a resolution concerning elections, real property, and community college apportionments for the year 2022. I move this resolution.
Seconded by Mr. Fay. Any discussion? All in favor?
Aye.
Opposed? Carried. Mr. Akers.
Mr. Chairman, I offer a resolution authorizing the chair to sign a contract with New York State Department of Transportation for accelerated transit capital funds and modifying the 2021 budget for the planning office. I move this resolution.
Seconded by Mr. Forsythe. Any discussion? No discussion? Roll call vote, Kelly.
Reagan,
Yes.
Forsythe,
Yes.
Lightfoot,
Yes.
Sheridan,
Yes.
Smithers,
Yes.
Denisha,
Yes.
Akers,
Yes.
Fay,
Yes.
Haggard,
Yes.
Piyako,
Yes.
Burke,
Yes.
Arquette,
Yes.
Terminelli,
Yes.
Curran,
Yes.
14 yes, 1 absent.
Resolution carries. Mr. Akers.
Mr. Chairman, I offer a resolution modifying the 2021 budget for the county clerk's office for a licensed plate cutter for the Department of Motor Vehicles. I wish to table this.
Okay. Motion's been made to table the resolution, seconded by Mr. Denisha. All in favor?
Aye.
Opposed?
No.
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 Want to do
Show
a
of
roll
hands.
call? We'll do a roll call.
I show it.
Should we do a roll call vote on that one? Oh, for sure.
Table till when?
That's a good point. Table till when?
Finance.
Finance? Table to the finance committee?
That's what I would like to do.
Table to the finance committee. Go ahead, Lil.
Forsythe,
No.
Lightfoot,
Yes.
Sheridan,
Yes.
Smithers,
Yes.
Denisha,
Yes.
Akers,
Yes.
Fay,
Yes.
Haggard,
No.
Piyako,
Yes.
Burke,
No.
Arquette,
Yes.
Terminelli,
Yes.
Curran,
Yes.
Reagan,
No.
10 yes, 4 no, 1 absent.
The table carries. Mr. Lightfoot?
I realize it would be a little bit out of order, but prior to Mr. Akers making that motion, it was my intention to do the very thing that he asked to do, but with an explanation. And I'm wondering if I might make that explanation now.
Go ahead, Mr. Akers.
I would say point of order that Mr. Lightfoot could do that in the whole new business.
Mr. Akers is correct, Mr. Lightfoot.
Thank you, Mr. Chairman.
Okay, Mr. Akers?
I got my momentum going here, Joe. All right, apologize, Mr. Chair. Mr. Chairman, I offer a resolution modifying the 2021 budget for property maintenance needs and energy costs due to the COVID-19 response. I move this resolution.
Seconded by Mr. Burke. Any discussion? No discussion. Roll call, please.
Lightfoot,
Yes.
Sheridan,
Yes.
Smithers,
Yes.
Denisha,
Yes.
Akers,
Yes.
Fay,
Yes.
Haggard,
Yes.
Piyako,
Yes.
Burke,
Yes.
Arquette,
Yes.
Terminelli,
Yes.
Curran,
Yes.
Reagan,
Yes.
Forsythe,
Yes.
14 yes, 1 absent.
Resolution carries. Mr. Akers.
Mr. Chairman, I offer a resolution modifying the 2021 budget for the county administrator's office to purchase a multifunction copier and set for printing. Move this resolution.
Seconded by Mr. Smithers and Mr. Denisha. Any discussion? No discussion, roll call, Kelly?
Sheridan,
Yes.
Smithers,
Yes.
Denisha,
Yes.
Akers,
Yes.
Fay,
Yes.
Haggard,
Yes.
Piaco,
Yes.
Burke,
Yes.
Arquette,
Yes.
Terminelli,
Yes.
Curran,
Yes.
Reagan,
Yes.
Forsythe,
Yes.
Lightfoot,
Yes.
14 yes, 1 absent.
Resolution carries. Mr. Akers.
Mr. Chairman, I offer a resolution modifying the 2021 budget for the county administrator's office for costs associated with community college tuition and move this resolution.
Seconded by Mr. Fay. Any discussion? No discussion, roll call, Kelly.
Smithers,
Yes.
Denisha,
Yes.
Akers,
Yes.
Fay,
Yes.
Haggard,
Yes.
Piaco,
Yes.
Burke,
Yes.
Arquette,
Yes.
Terminelli,
Yes.
Curran,
Yes.
Reagan,
Yes.
Forsythe,
Yes.
Lightfoot,
Yes.
Sheridan,
Yes.
14 yes, 1 absent.
Resolution carries. Mr. Akers, will you present this resolution?
I will, thank you, sir. Mr. Chairman, I offer a resolution authorizing the filling of vacancies and move this resolution.
Seconded by Mr. Smithers. Any discussion?
Mr. Chair,
Yes.
may I speak to this resolution?
Yes, you can.
I spoke with legislators Perkins and Akers, who represented the board on the vacancy review committee this month, with what I consider to be an urgent fill. I met with both the treasurer and the human resources director to review the options and opportunities based upon a resignation and relocation of our fiscal manager in social services. So that being said, I did not believe it was in the best interest of the county to wait until January to bring this forward. So I spoke with both legislators who agreed this could be added to the agenda. We reviewed the duties of the position, and we actually are recommending through this resolution that the fiscal manager be abolished and an accounting supervisor be created. It is a higher compensation associated with the duties required of this position. So that is why it is added to the vacancy resolution this evening. Any questions? Thank you.
No questions? Okay, any more discussion? No discussion, all in favor?
Aye.
Opposed? Carried.
Thank you.
Mr. Akers.
Second, Mr. Chairman. Accidentally put my iPad to that spot.
So it's the one that has, the resolution got to be unanimous vote.
Yeah, I hit my finger, hit this and it took off. All right. Mr. Chairman, I offer a resolution authorizing the printing and or distributing additional information explaining exemptions on the back of the 2022 real property tax bills from the city of Augsburg. I move this resolution.
Okay, seconded by Forsythe. Any discussion? Any discussion? No discussion. Let's have a roll call on it because it's got to be unanimous.
Mr. Chair.
Or else we could just go all in favor. If everybody agrees, we see everybody's hand up, it'll be unanimous. Let's go that way. Go ahead, Mr. Forsythe.
What's the reason for, gotta be unanimous?
I don't know. The reason, that's just what the notice under the resolution. I imagine the county attorney had something to do with it.
Bruce, no.
Go ahead, Ruth.
So many years ago, some of you may recall in the year 2003, we passed a local law which allowed us to insert information about staying local with your DMV transactions. And at that time, we scripted the local law to provide for the option for us to do that. In 2015, the board rescinded that local law and passed a resolution that required with unanimous vote the authority to place information on the tax bills. There is only so much space, and we are very careful about what's placed there. In Google Drive, you have a picture of the chart with the exemptions that will appear to assist the folks in Ogdensburg interpreting their tax bills for the first time from the county.
Let's do it the easy way. All in favor?
Aye.
Is there anyone opposed?
I'm almost tempted just to do it.
No one's opposed? Carried, unanimous, great.
Thank you.
Okay, now, Mr. Akers, would you present this resolution?
I'd be proud to, Mr. Chairman. I offer a resolution for the adoption of the 2022 budget.
Is there a second? Mr. Lightfoot and Ms. Haggard, seconds. Any discussion? Mr. Denise?
Yeah, the resolution, as it reads, says adoption of 2021 budget. I mean, we, the resolution, it discusses 2022 budget.
It's supposed to be 22. Our apologies.
Is that a typo? We can just fix it up, make it.
It is, it's not
Good,
something.
typo, good. Any other discussion?
My mask on.
No other discussion?
Well,
yes, go ahead.
I have a comment. I mean, this is, for 7 years now, we've had a balanced budget and putting money back into it. And we've 6 out of 7 years, we've actually decreased the taxes. I was hopeful that we could get under $8. We're almost there at 8.02. And this is kudos to our administration, our department heads, and particularly our employees for making this happen. That we've been able to actually lower the tax levy and actually and the tax rate both at the same time, which is the first in my time since here since 2011. And thank you to Ruth Doyle and her staff, Dylan, for making this happen.
Any other discussion? Roll call vote?
Denisha,
Yes.
Akers,
Yes.
Fay,
Yes.
Haggard,
Yes.
Piyako,
Yes.
Burke,
Yes.
Arquette,
Yes.
Terminelli,
Yes.
Curran,
Yes.
Reagan,
Yes.
Forsythe,
Yes.
Lightfoot,
Yes.
Sheridan,
Yes.
Smithers,
Yes.
14 yes, 1 absent.
Carried. Mr. Akers?
Mr. Chairman, I offer a resolution authorizing the chair to sign a contract with Usherwood Office Technologies to purchase a multi-function copier with central printing. I move this resolution.
Second by Mr. Lightfoot. Any discussion? No discussion, all in favor?
Aye.
Opposed? Carried. Mr. Akers, would you present this resolution?
I will, Mr. Chairman, thank you very much. I offer a resolution authorizing the chair to sign an agreement with the towns of Brazier, Norfolk, and Messina related to a public service law, Article 10 proceeding, recommending the issuance of a certificate of environmental compatibility and public need to construct an industrial scale solar generating facility.
Seconded by Mr. Burke. Is there any discussion? Oh, go ahead, Mr. Smith.
Yeah, there's been some report about an environmental problem. Can we find out if there's any basis to that? Just being on some wetlands, and how serious is that? I'm sure that you've heard about that.
Go ahead, Mr. Akers.
So I think Mr. Smithers is talking about an article that appeared in the Watertown Daily Times. I didn't get a chance to read the specifics But I think it's a 25-page report, basically on some of the deficiencies and concerns by the Department of Environmental Conservation. So I don't know if someone else has read the article, could elaborate. It's, I guess, is there a time factor with this, Mrs. Doyle?
I would have to defer. I'm checking with the county attorney now. I'm not sure he's on.
Okay.
Move to table the finance.
Second.
Seconded by Ms. Haggard and Mr. Fay. And all in favor?
Aye.
Opposed? Carried. Table. Okay, Mr. Lightfoot.
Mr. Chairman, I offer a resolution authorizing the chair to sign a contract with the St. Lawrence County Deputies Association Incorporated for the years 2022 through and including 2026, and move for its adoption.
Seconded by Mr. Akers. Any discussion? All in favor?
Aye.
Opposed? Carried. County Administrator's report.
Just a couple of items tonight. First, I want to thank you for unanimously, with one exception, with absence, adopting the budget for 2022. This will be the single biggest true value tax rate decrease in recent years. Our hope is certainly that we can work tirelessly to put this budget into place. Department heads, as Legislator Akers mentioned, department heads and fiscal staff worked very hard, and then my budget team did the final heavy lifting to bring you the budget to make sure from the county standpoint that it costs less to live here. There are many unknowns, as we see and hear each month. The increase in COVID-19 will place demand on our departments and our services. We will be looking to make some shifts to address the recent increases. I want you to know how much I appreciate the vote of support and also allowing us to move forward with that budget on January 1st. I do have 6 transfer funds to report out to you. Pursuant to local law C, any transfers I can make between 200 and 400 accounts. I have a $700 emergency services transfer associated with COVID charges for the remainder of this year. I have a $900 charge for the postage machine in the mailroom that they're every other year, I believe they replace that. Another for the Board of Legislators office, the increase in expenses in the print shop. I believe we have adjusted for that for 2022. We also finalized leases this year for our satellite locations, and they include the county clerk's office and probation, also community services. But for the county clerk, a $1,050 transfer to cover the adjustment in signing that new lease. In probation, there is the Messina District Office, $1,370 adjustment, as well as a $1,562 adjustment for the Ogdensburg office for the same reason. So fortunately, all these departments were able to find these modest amounts within their budget so that we don't have to bring you resolutions. Did want to make sure that all of you saw the note from our highway superintendent with regard to our Lisbon outpost. The sand and salt storage area was damaged, sustained a complete loss of 50% of the trusses last week with the windstorm. I was informed this morning that the contractor's claim has been affirmed, so those will arrive for replacement in March. As all of you are aware, many supplies and materials take an extraordinary amount of time to be replaced. But I was also pleased to hear today that with the footing and the concrete that's already in place and not hindered by the storm damage, we will be able to bring sand and salt there. We have never enjoyed what we will soon, which is covering of all our sand and salt. So that will be able to proceed as planned. The contractors redoubled their efforts to finish the facility so that we stay on schedule, and that did not sustain damage in the recent storm. Any questions on that?
Did you say Mark?
March,
The trusses?
I believe so.
You know where they're buying them?
I can find out.
Yeah, I'd be interested to buy them because the whole lot I just ordered was 6 to 8 weeks, so that just seems excessive.
A long time. I can find out.
Yeah.
Vacancy Review Committee,
Well, I was gonna say, I wrote Clerk roll-off, which is now struck the wood.
Yeah.
And I was supposed to have them on week of Thanksgiving, and now I'm getting them at Christmas break. That was 6 to 8 week work.
And then 2 weeks early.
okay. Vacancy Review Committee is scheduled for tomorrow. There are 5 departments that will bring forward 9 vacancies to be considered. Just to give you a brief synopsis on the COVID-19 side for the county, there are 5 departments, 4 with COVID positives and 1 awaiting test results. And just to clarify, there's a reason that I don't provide you with where the departments are handling COVID positives. And that is, while we have departments of 250 in social services and probably another 30 to 40 in public health, we also have departments of 2. So if I was to share with you each of the departments where it's present, it would be much too easy, and I would not be able to protect the health information of our staff. So to keep it equal, I just let you know how many departments. We have our own cleaning equipment now. We are making sure folks stay home if they're sick, and as quickly as possible getting tested. So just to give you a little clarity, I know a few of you had questions. Our public health department will be offering employee boosters on December 15th, and I'll provide release time for employees if they're interested. The state has now renewed the control room type calls. They are keeping them at this point to chairman and manager administrators like myself that will occur every Friday, which will work out nicely for us as we continue the entire COVID period with the weekly calls of the COVID work group so that we can check back in. That's really our check-in point with hospitals on a weekly basis. And we have increased that level of communication with our work group depending on demand. So we will start hearing from the region. This time we were combined with the capital region, but I would imagine as they assemble, we'll get back to having the North Country on those calls. Also wanted to make sure that you're aware as of Friday, I think Chairman mentioned it, but the counties I was aware of as of Friday were Monroe, Ulster, Wyoming, Franklin, I believe New York City, have all declared states of emergency or renewed them. Clinton County never expired their state of emergency, so they're still in place. And Essex, Lewis, and Jefferson are all considering now. So I do have the state of emergency declaration prepared for the chairman to sign following this meeting. Also wanted to let you know that we are and already have been planning with regard to any continued increase that we see, working with the Board of Health, working with the Public Health Department. It is their recommendation, both the Board of Health and the Public Health Department, that we declare a state of emergency. And lastly, just wanted to give you an update and keep you apprised. The agency review was on site last week. Bonadio was present. They had some interviews with caseworkers and submitted lists for case review. So that is continuing. They plan to be back on site next week, and I can inquire about the timelines associated with any interviews of specificity. Are there questions?
Go ahead, Mr. Smith.
Yeah, on this state of emergency that you mentioned, what would be the pros and cons of that? What would be involved? Would this mean more mandates, mask mandates? What would that entail? Can you give us more specifics on what would be involved?
At the current iteration of the recommendation is to bring attention to the hospital challenges that Dr. Williams spoke to tonight. And that is in keeping with the state's declaration of emergency. Some counties are looking at a variety of emergency orders, which is, as you described, everything from mask mandates to the ability that you have through states of emergency to take other measures. I believe the only interest in this evening was to make the declaration with regard to bringing attention to the hospital's challenges at this time.
So if it got the hospitals more attention, what would that involve? Would they get money from the state or just public recognition, or what do you mean by that?
All of the above, essentially. One of the areas that I think is important with the state of emergency is bringing more public attention to it, but also if in fact funds are available and a declaration is required in order to be eligible for those funds, that assists as well. And we're also looking as a region at a collective statement with regard to the numbers that we're seeing in the North Country.
Mr.
Denise?
You said the state of emergency was recommended by,
The public health director, interim public health director, and the Board of Health.
Yes, go ahead, Ms. Safford.
Thank you, sir. Ruth, of the counties that you mentioned, do you know which ones of those included an indoor mask requirement?
I have not yet seen them all, but I am aware that Monroe County listed each address of their county facilities and included a mask mandate for them. But I can get copies of the rest of them and share that with the board.
Because, can I just follow up, Mr. Sheridan?
What's that?
May I ask her another question?
Yeah, go ahead.
Okay, thank you. So, would that be something we'd have to do separately, or could it be done under the state of emergency?
The declaration doesn't have to include it, but an emergency order can follow.
Okay.
Perfect.
I think declaring a state of emergency is wonderful. I think it's appropriate. I guess I wonder, relevant to what Dr. Wayne said, can we not also ask, maybe even in a public forum, for increased state vaccination sites and state testing sites? He said it would be, he basically outlined our position as being, you use the word dire, but that's the way I interpret it. And I guess I'm wondering, shouldn't we specifically ask for the type of help that we need and do it in a public forum?
Certainly. What I understand is at the current time, the state will be deploying 13 combined test vaccination sites. I believe those have all been cited at this time, but I have been asking since they mentioned that they would do this for St. Lawrence County to receive one. But certainly an echo from the Board of Legislators is always appreciated. And certainly to put that out there would be welcome.
Mr. Akers?
Thank you, Mr. Chairman. So declaring a state of emergency, if that is the primary objective is actually to increase public awareness. I mean, that's all that's been on the Channel 7 news here the last few days, in interviewing hospital staff and whatever else. And that's why I asked Jolie Munger, our public health director, interim, how the vaccination rates go up, and they actually have not. Because we were talking about 1,000 people a week. She's saying a little less. And then the critical group, which Dr. Williams actually talked about, was the 55. So 45 to 55. We don't see really any increase in vaccinations in that particular group. And so what I've said before is you can bring a horse to the water, but you can't make him drink. So it is what it is. So if by declaring a state of emergency actually brings either financial support from the hospitals or actually manpower, human power, whatever, to the hospital, then I think that declaring a state of emergency is, okay, hey, we did this, look at us. You know, we're aware of the problem. But in actuality, an objective actually creating an actual result, I don't see where it creates a result. If you go into the stores, and I don't go into that many, but the ones that I do go into, many of the staff, Lowell's, everybody is wearing a mask. They are in Home Depot. They are in the grocery store in Waddington. And many of the individuals that are coming in shopping have made the decision that they're going to mask themselves. So I would say that probably masking on its own has increased probably 50 to 75% of people making that own choice without any state of emergency. And so people have made up their minds about this. We're almost 2 years into this COVID thing. You know, it's very clear that getting the vaccination can help prevent you coming in the hospital. And certainly, as Dr. Williams demonstrated in his statistics, that there are other breakthroughs. So you get, what, was it 30-some-thousand people who have been vaccinated here in St. Lawrence County, and there's 9 individuals that have breakthrough that are in the hospital, where you got 3,000 or 3,400 that are unvaccinated, they got 19, right, that are in the hospital. So it's quite clear that if you're vaccinated, you have some type of prevention. Now, it's not 100%, but at the same time, it is producing a result. Obviously, with 9 out of all the ones that had been vaccinated through the breakthroughs that ended up in the hospital versus 3,400 and they got 19 in that representation. Statistically, it's much higher that you're gonna end up in the hospital. So people have that data, they see that. And so if we're not going to get resources or additional labor to the hospitals, whether it's testing or whatever else, I'm not in favor of doing it.
Ms. Snyder?
Thank you, Mr. Chairman. It seems to me the combination of the kinds of numbers that we're showing in positive cases and the spike that we've had, perhaps by declaring a state of emergency in conjunction with the knowledge that the cases are going up the way they are. And I think that that is being reported every day. I'd like to think we could make that horse drink. And I'm glad to know that there are people wearing masks in stores voluntarily, but well, I won't say it at this time. Thank you.
Denisha, a lot of you were well aware, I made the statement earlier, that we have no healthcare professionals in this room. The only one we have on board, as far as I'm aware of, is legislator Curran. So,
Mr. Burke.
in my opinion, public health, the Board of Health recommend that we declare a state of emergency. And there are no mandates attached to this. The professionals are telling us what we need to do. And, you know, that's like our county highway superintendent has some advice on a highway or a road or a bridge or something. We said, well, we know more than you do. You know, it doesn't make sense. If public health, Board of Health say we need to declare a state of emergency, whether we like it, whether we agree with it or not, they're the professionals. I think we should follow their advice.
Go ahead, Mr. Akers.
So let's go over that advice.
What's that?
Let's go over that advice and on the national level. First of all, we were told that we didn't need to wear a mask, right? Then, and actually, I can quote Dr. Fauci, he basically said the masks are ineffective, you know, for droplets, right? Then it became, now we need to wear a mask. Okay, we got one mask, now let's wear 2 masks. Then it was, if you get vaccinated, you won't have to wear a mask. So that was the encouragement to get a mask. So now, people have made that choice. They took the risk, whatever it was, whatever they felt in their own minds what that risk was. They got the vaccine, so they didn't have to wear the mask. So now we're telling people, the science is, well, you know, you're vaccinated, now you really should still really be wearing a mask. So if you're looking at Mr. Denisha's argument about public health and whatever, what the advice has been, you'll see that is cyclical in nature. So it's not gospel. And the science is definitely evolving, and science always needs to be challenged. So in this particular situation, I'll just reiterate, if it's not bringing additional resources, whether it's testing or financial support to the hospitals, I think that it's just a state of emergency is actually lip service. Thank you.
Somebody on the screen?
Yeah, Nicole.
Nicole, go ahead.
Thank
Your
you,
hand's
sir.
the same color as the white wall behind me. I couldn't see it.
I'm sorry. Don't worry. I would have used my big voice if you didn't acknowledge me. I promise. So I guess I always oftentimes get confused when we get talking about this stuff because I think we were talking about whether or not to have a state of emergency and somehow mask mandates become part of the conversation. So if there's not a negative impact to declaring a state of emergency and our public health is recommending it, Dr. Williams is recommending it, and if the state were to decide to allocate some kind of support, whether it be funding or anything like that. They're definitely going to prioritize counties that have declared a state of emergency, I'm assuming, but again, I don't know much about anything. So if it's not going to get in our way, and I don't really think that whether we declare a state of emergency or not has anything to do with a mask, anything, I think that we would take the recommendations of the people that we entrust to make these decisions for us, and I think that we would support them and go with it. But again, I don't know much.
Mr. Reagan.
Mr. Chair, can we ask for a show of hands on how many people support a declaration of emergency?
Yes, you can. How many people favor having a state of emergency declared?
Nine.
What do you count?
That's nine. Nine yes.
9 yes?
2 absent.
Mr. Chair,
Yes.
can we move on?
Go ahead.
I'd just like to make one little point, is the mask mandate, if it does become an issue. I look at school districts, every time we go to a basketball game or whatever, everyone's masked to the hilt.
Yes.
And my grandkids are quarantined every other week. I don't know how families do this. And everyone in the school's masked, from the janitor all the way through. So obviously something doesn't work. I don't know what it is, but I'd have to debate real hard about a mask mandate after I watch that in the school district. And I know we have employees going through it here. I don't know how I just don't know how they can take care of their kids. It's just amazing.
So everyone in here is under the impression that when we go to the state of emergency, there's not going to be a mask mandate involved?
Right.
I would imagine that.
Is that how the feeling is that that's one of the reasons you voted that way?
Oh, Mr. Chairman,
Yes.
are you asking, I voted for the state of emergency. I personally would love a mask mandate, but that's not what you're asking, right?
Right.
Right.
I didn't think so. Okay, thank you.
I'm wondering, is there anybody here that thinks that will be part of the state of emergency mandates to go along with the state of emergency?
No.
Mr. Akers?
We just heard in a report tonight that New York City wasn't a concern, but then New York City is actually in a declaration of emergency, right? State of emergency, right?
That's what we've been told, yes.
So we just heard that the data that the city is actually doing so much better,
There.
but then they declared a state of emergency. Which, and I think de Blasio is going to try and force all private business to require masking, right? Is that today's news?
Yes.
That's
Okay,
it.
so there you go.
Mr. Chair,
Mr. Smith?
I just want to look at the numbers. You have 34 people hospitalized out of population in St. Lawrence County of
No.
108,000.
8,000. Emergency implies there's a drastic need of something. It strikes fear to people. And I know people that I associate with have had enough of the mandates, COVID. They've made their choice whether to get vaccinated or not. And if we tell them they got to do this or they got to do that or throw this out, they're not going to take us seriously. I don't think it's going to do a thing.
Mr. Reagan?
Mr. Chair, you're gonna sign a state of emergency. You're not planning on signing any mask mandates or any other mandates or any other rules at this time. You've seen 9 of the legislators support you in signing a state of emergency. Our public health department is urging it. Our public health councils are urging it. There is a possibility that we can get additional resources steered our way. The county administrator recommends this. Let's not get onto these other things. Let's focus on something that we can do tonight to highlight this problem and make the citizens of the county aware that there is a crisis, that the emergency rooms may soon begin overflowing, and there may not be enough emergency beds for everyone who needs one. So, you know, let's not get onto these tangents. Let's get on to the business of this board, but let's give the county administrator, let's give our healthcare professionals the assistance they need.
Anyone else?
Rita had her hand up. Miss Curran.
Yes, Rita, go ahead.
So my first year in nursing was in school in 1990, first year out in the world of Syracuse, 1994. First to upstate ICU, then on to the ER for 20 some years. Only in 2012, when the flu was rampant and we were really trying to struggle to find places to put people who couldn't breathe when they came in, did I become concerned. The fact that they gave away free Pradaxa for blood thinners and people were having problems, that didn't even really bother me because there was a limit to it. You could pull the Pradaxa. However, this seems to not really have a defined limit. It's not really seeming to go away like the flu. I sat there the other night waiting for someone to come take care of my father. I had to wait until somebody could come out and triage him with his little pulse oximetry of 80%. He was confused. And for the first time in my life, I was not convinced that the public health system around here at that hospital, at least, and I knew Ogdensburg was full, I wasn't sure that we were going to have a bed for him. And it's not just because it was my father, because if it's just my father that you can't take care of, I can probably take care of him. But how many other families are in this situation? And if we have hundreds of more cases next week, how many more families are going to be in this situation? And I don't know that a state of emergency is really going to take care of any of that or all of that, but it's some place to start with a declaration that we take this seriously, that there is a concern on our behalf about what's going on in our community, and that we would like to try to make some kind of a plan. And if we can get extra funding from the state, great. But we have to try to do something, because what do you do with the families that can't get care for their families? How do you explain that to them?
Mr. Lightfoot, when we had our state of emergency, when you were the chairman, was there any money that came our way from the state of New York or help?
Not that I know of. I would say this, Mr. Chairman, is you've got 9 members of this board that want to see a movement on your part to sign that declaration. But that declaration isn't going to create one more hospital bed in St. Lawrence County. We've got what we've got, and we're stuck with it, unless the state comes along and puts a tent up somewhere and do much like they did in some of the metropolitan areas. So I have no problem following the will of the board. That's the will of the board. Get her done.
Anyone else? Well, so that's probably what we're probably gonna end up doing. So.
There is old business yet, Mr. Chairman?
Yeah, we have any other old business, new business, anything like that?
Yes.
Yeah, go ahead.
Listen, all I wanted to do was say that before Mr. Akers made the motion to table that, it was my intention to do that very thing. And my reason for doing that was that this afternoon, I tried to get over here in time to meet with the county clerk to bring what I am proposing with regard to this metal shear and talk to her about it and get her feelings about it before being blindsided by what could have happened tonight. So I'm very happy that it did get tabled, but I think that there's plenty of reason for her to take a look at this and give us her take on it. If there's some reason that it won't work in her department, then I want to hear what she's got to say about it. The other part of that, and I will get into it in detail, are the reasons why we should be looking at this, not just at the money, but the contraption itself. That's why I asked Dylan this afternoon to send out the video that was provided to me by folks down in Cortland, New York, that have used this thing for 10 years and haven't so much as pinched the skin on their fingers using this thing. And I told that they cut a heck of a lot of plates for them. So I think that money alone is a good reason to do it. And if you do the math, you'll see that it's upwards of $8,800 more to buy a piece of equipment that we actually don't even know what the specs are on it. Some of those things require 3-phase power or 230 volts. Some of them, require filtration because they make, when they burn this stuff up, they make dust. Probably requires a
Then that's it.
Pardon?
That's the area.
Well, yes, but a service agreement, this thing doesn't. And it's just, I'll go over it at finance with what they are. I don't want to belabor the point, it's getting late. But I just want to let you know that that was the intention all along, was to table this so that the county clerk can weigh in on it and not be blindsided with something that passes tonight without our knowledge.
Okay, any other old or new business? Burke.
If I could bring up one more time the sales tax on heating fuel. And I will do it in the form of a resolution in just a second, but along with what Kevin has said, the county has been very successful in the past 6 years. Our resources are good now, where they weren't years ago. And I know, and I've listened, what Dave has said in the past, that he would really like to have a big tax break for all the residents of the county. This is an opportunity. And granted, it's not just for the people, who need it, and there are people who need it. This is for all of the taxpayers in the county. And let's do it for the heating season, and let's make the towns whole. Let's not ask them to chip into this. So the county, I guess I would propose a resolution to have sales tax on heating fuel lifted until May 1st of 2022. And whatever tax would normally go to the towns and villages, that should continue, that the county would underwrite that. If we can use the American Rescue Plan to fund it, that's great. If not, then we have some sales tax money, or we have some funds that we're getting from American Rescue that would be pretty close to offsetting that. I believe, Ruth, don't we have isn't Renee working on a $3 to $4 million?
Mm-hmm.
So that's a resolution. I would ask somebody to second it. And I know there's feelings in here about it, but it's an opportunity to give back to all of our taxpayers. Your idea originally, Bill, Larry certainly has supported it. And I just, if we're gonna do it, the clock's ticking. We're well into the heating season. So I just throw that up for consideration and offer it as a resolution.
A second.
I will second that.
Mr. Forsythe?
We have a discussion.
You want discussion? That's been made in the form of a motion, you seconded it, and now we're gonna have discussion. Okay, go ahead with this discussion.
I like the idea of it, I'd have to know the cost, I'd have to know the cost associated with it. You said that we're gonna take the towns and villages out of the equation, so that would increase the cost to us. Correct?
If I could, can I respond?
I don't know.
My understanding, Dave, is that it was gonna be about 4.2 million total cost. 4.2.
What is that?
That, if we,
Oh, we can pull that, Mr. Chair. We can pull those numbers up if you give us a few minutes.
and that was that was my understanding, Dave. That was a total cost, and that we would not ask the towns and villages to forego their percentage of the sales tax.
The other question, I guess, is how will the distributors, how quickly could they be on that, you know, to change from 8% down to 0 or 4%, I guess it's all the charging home heating, but how quick are they to respond? It's almost mid-December. I don't know. I guess if I knew what the numbers were.
We would have to coordinate with tax and finance for the state as well.
Figure out how to do that.
Mr. Burke, you're correct. I've always been in support of this idea for years back. And I still am. However, like Mr. Forsythe, I don't know that I feel comfortable voting on a resolution like this without looking into the cost. I do understand from listening to what Renee Cole has said, our county treasurer, that it's going to be a substantial tax hike. It would have a big effect on the taxes. And I think a better idea, a better approach would be to maybe form a committee and have a committee study ways that we could afford it or that we can afford it by looking at different ideas in terms of how to do it. But we may find that we just can't afford to do it. I'm not in favor of having a big tax increase in St. Marks County. But at the same token, I believe we've got to do something, always have, to relieve the burden, especially the cost of inflation and the cost of the increased costs on heating oil, vehicles, and cars, propane, and whatever it is, whatever heating fuel you're talking about. It's going to be very hard on families in St. Lawrence County to deal with that this year. So I agree with there on one hand that I'd like to see something done, but I don't want to march into something blindly, not realizing what the impact is going to be. And so I just couldn't automatically vote for that idea that you're talking about right at this point, especially after hearing the conversation from the county treasurer the other day. Go ahead, Mr. Akers.
Well, it's 4.3 million. I think $440,000 represents a 1% tax increase. So this would be a pretty close to a 10% increase in taxes, much what Mr. Forsythe had asked about back then. And actually, I think 10% would be about $5 million. This would be a shift from everybody paying the tax to a shift completely to people who own property. Because those are two sources of revenue: sales tax and property. Property taxes are the two major sources. And so I would, I'm fine with your committee. I would have Renee certainly be on that. She's got the numbers. She's the one that would be scared of such a proposal. And I'm moving to table.
You're moving to table the resolution. We have a motion and a second.
Until when?
Give us a second, yeah.
Do you have an idea on when?
We can move it to, I don't know, how fast can you think you can put a committee together to study this?
From my experience, it'd probably be 2 or 3 months.
So the local share, from my calculations, is be about 1.8 million. I think it's $2.5 million would be the county cost. And for the towns, that would be, if the towns, if part of it that the towns were reimbursed, that's $1.8 million. So the total bill would be 4.3 million. That's a 10% tax increase, 9 to 10% tax increase.
Yeah, I mean, it's devastating when you put it that way, and that is maybe the way it'll be. Unless we get real creative.
County attorney has his hand.
Go ahead, Mr. Dave Button.
Thank you. I apologize for interjecting, but I think Ruth mentioned something that is worth noting. Anytime you mess with the collection or impose exemptions upon the imposition of sales tax collections associated with an item, it requires that you coordinate that action with the state. And I think we're all more than aware that recently there was certain sales tax action taken by others that resulted in what they thought was going to be an immediate ability to impose sales tax collection of their own that is now delayed essentially until March, April. So I think it's incumbent, if the board truthfully is interested in moving down this path, that we check with the Department of State to see that if we follow their form and if we pass an appropriate piece of legislation, whether it be through the resolution or local law form, that it would grant immediate relief and not be something that would be delayed until the next quarter of sales tax remittance. I just wanted to put that out there because I heard Mr. Burke indicate that the objective was to try to render help to those who need it during the winter months, and that's a very laudable goal. It's just, it would be a shame if we got all the way down the path and discovered that we can't even impose the exemption until you get to March.
Good point. There's an awful lot of things we don't know about the ramifications of the whole idea, and it needs to be studied closely and looked at carefully and before we make a decision. Go ahead, Mr. Denise.
You know, there was an idea when we talking about this.
Word of order. You do have a motion to table. I don't know if that received a second or not. So the motion
It's been seconded.
It has been seconded.
Okay.
So there is no discussion on the motion.
The table hasn't been seconded.
It has not
It's
been
the
seconded.
motion.
Okay. So the motion's still there. If someone wants to table it, they can.
I'll second.
You're seconding
I
it?
second.
Okay, second by Mr. Lynn.
For discussion.
For discussion.
To when? A date?
Yeah, we were talking about the date.
Yeah.
So I would do a month.
If you're gonna have something tabled, you have to have a date that you're gonna
So
table.
so the January board meeting.
January board meeting, full board,
A month.
all in favor of the January board meeting, dating, the resolution as that being the date?
The motion is to table to the January board meeting.
While you form a committee to research it.
Correct.
Yeah.
So we have to vote on that.
We're voting on the motion to table to January 30th. Or January, I'm sorry, the January board meeting.
So there's no more discussion.
No discussion.
That's correct.
Okay. All in favor of tabling it till the next board meeting, January 2nd, 3rd, whatever it is.
Not set yet. It would
3rd,
be the
January 3rd?
Will there, a question?
Yes,
Will there be a committee appointed prior to that date?
there will be.
Okay.
All in favor?
Aye.
Opposed? 2 people are opposed to it? 1, 2. Mr. Burke, Ms. Haggard, anyone else opposed? 2 people opposed, carried. Okay, any more old in the business? If not, let's go on to committee reports. Any committee reports? that need to be
Mr.
had?
Sheridan?
Yes, go ahead, Mr. Rowland.
Hi, thank you. Sorry. I just wanted to ask, now that we know that our county attorney is on, we've in the past talked about the family court cases being on a really huge delay. And I just wanted to see if we could get an update on that. I not super familiar with the way that we go about getting family court judges, but it seems that it has to be created through the state, if I'm accurate in that, and that it's part of their budget process. And I'm just wondering if we are still really far behind, if it's something we might want to consider reaching out and asking the state to consider in their budget. So Mr. Button, could you just let us know how we're sitting currently with family court cases?
I can. It's actually an interesting question, and I've gathered a fair amount of information associated with it. Obviously, it's an important subject for us, given the fact that I'm now running the legal unit that is handling the DSS activity, and there is a fair amount of volume. The good news is that, just as a little teaser for what you'll see on Monday, we've got fewer kids in care as of today than we did at the end of last month. In fact, it looks like we've had a net decrease of about 5 or 6. So we're at about 302 kids in care. That's still a significantly higher number than I would like to have. One of the ways that children leave care is either they're returned home to their family or they go through an adoption process. For the adoption process, we have to prepare a packet. And once that packet is prepared, it's shipped off to the family court. Family court gets an opportunity to review it and then moves it forward for scheduling. It's my understanding right now we've got 8 packets that are sitting over there, some of which have been sitting there since the summer. And we've got more packets on the way. In fact, I've been advised we may have between 7 and 15 more packets that will be headed over there shortly. The number of children that have been either freed or returned home are growing steadily by the day. The difficulty I note is that we have one judge, our only family court judge, that is at the end of her term. She is essentially leaving, as I understand it, before the end of the month. And the other family court judge that's recently been elected will just be coming on at the beginning of January, which will leave a gap. And I think you're all aware that life doesn't stop for gaps or vacations in governmental service. So my concern is what happens over the holiday period. I do know the court system is looking at it. Originally, there had been a push to have a second family court judge here in St. Lawrence County. That happened about 10 years ago, 10, 12 years ago. When that judge didn't materialize, they created a second judgeship over in Franklin County. That judge has, I think you're all familiar with him, is Judge Champagne. Judge Champagne, and it's my understanding the newly elected judge, Judge Carrero, will actually be coming to help with our family court load in January, and we'll be doing some of that work for the indefinite future. So I'm pleased to know that OCA is redirecting resources towards us to help us with the backlog. I'm also meeting with the new judge-elect on December 17th, along with hopefully the public defender and the conflict defender, so that we can talk about all of these children that are technically in care with the Department of Social Services, but they're at home with family members. And our preference would be to move them out of the care of the Department of Social Services if they're at home with a loving relative. So that's one of the things that we're going to really try to focus our attentions on and hopefully find a receptive court. As for your question to lobby or to move to try to secure a second family court judge position, it is a situation that is created through the budget process at the state level. As you know, every year we designate a certain number of items as our key items to lobby or push the state for. This is definitely one that I would think would be an appropriate lift for us to try to get involved with. I know a couple of years ago, and I've talked to you about this, I went with, at the time, the head administrative judge for the 4th Judicial District of the 3rd Judicial Department, that we're in the 3rd Department, 4th Judicial District, down to meet with Speaker Hasty's office and meet with, at the time, the senior leadership on the Republican side of the Senate to try to push for the creation of an additional position in the budgetary process. And it just didn't get anywhere there. I know, though, that OCA was supportive of that activity. I'm not going to hold out too much hope because I know that there's been a lot of activity of cutting back judicial positions over the course of the last 12 months to 24 months. But I do think it's something that would be a worthwhile cause to push for.
Thank you very much. I would like us to very strongly consider it and look into it.
Mr. Akers.
Thank you, Mr. Chairman. I have some new business. I have some concerns, particularly the last audio that we got in public comment from Dottie Spears. We were assured when we actually defeated the resolution back in finance, or actually it was services, that material of sensitive nature concerning if CPS workers were actually, or DSS workers were actually foster parents, that there wouldn't be any interaction, that there were limits, there were protocols about how what information would be shared. And what Dottie Spears referenced in her audio that we all listened to was a very specific email where the foster parent had reached out to the attorney for child and making her fears known about what the potential would happen if the child was removed from them. And it actually indicated that the visitation supervisor had given this foster parent some information. And I think that that's a clear violation that needs to be looked into, whether it's ourselves internally here or the Bonadil group. If things of sensitive nature are being shared between people who have oversight over the foster parents who actually turn out to be DSS workers, then that's not what Heather Rand said what the protocols are. And I think that specifically this needs to be looked into. It seems to be very specific information. You have the audio, you can see the assertions that were made in the audio. She read it from an email, I believe, and that needs to be looked into whether something has been crossed. Obviously, the visitation supervisor, according to this, and it's from the foster parent herself, in dialogue with the attorney for child for this individual, her grandchild. There's a clear violation, I believe, of what I would consider sensitive nature. So I think it definitely needs to be looked into.
Will do.
Ruth?
Will do.
Will do.
Thank you.
Back to Nicole's question on the family court that she posed to the attorney about, should we start a committee and maybe get more aggressive towards looking at a second family court judge, or what do you think, you know? I guess
Whose hands up?
Steve's up.
Steve, go ahead, Steve.
To answer Mr. Forsythe's question, traditionally, the chair has appointed a lobbying committee or a group to pull together a list of items that are appropriate. I know Ruth is normally a part of that group that designates sort of the interest that the board has to bring to the state during the budgetary period. So I would imagine this would be one of those elements that would be included in that list of items that we would be looking to target anyways.
Seems it should be a priority, sure.
Yeah. One of the things we'll have to consider with that, I just had a jury board meeting last week, and that is, there is some hope from our people in the judicial halls up there, that judge that's coming over from
Carrera.
the other county
Yes, Carrera.
is going to alleviate a lot of our issues when it comes to family court. He's going to spend an awful lot of his time on family court matters in addition to the new family court judge, number one. Number two, there's a concern that we've got to provide the courtroom and the space for the manpower to run family court if we did come up with other things. And that's going to cost money. So that's some of the things we have to look at before we go ahead with wanting to go full speed ahead with the family court judge. So that would be one of the things this committee will have to look at. And we'll have to talk with some of the judges that we already have on board and get their opinions on. Just maybe, it might sound nice to have another family court judge, but then the other thing is, there's a small pool, maybe you can correct me if I'm wrong, Mr. Button, but there's a small pool of attorneys who work social service work and family court work on these matters.
That's Mr. Chair, I apologize, but that is correct. There's a significantly small number of attorneys that will accept assignments in the family court. There's an even smaller number of attorneys that will act as attorneys for the children. I think there was a reference to the AFC having received an email from the foster parent from Mr. Akers. The AFC is a designated attorney from the 3rd Department Judicial Division down in Albany. They aren't even appointed by our local court. The local court doesn't appoint our family court judges, but our family court judges are pulled from a pool from our 18B assigned counsel program, and it is a very, very small group, and unfortunately growing smaller and smaller, it seems like, by the day.
So hypothetically, if you had two family courts going at the same time, and you got this small pool of attorneys, they could be called back and forth to one court versus the other all day long, and it would drag the court systems across their production down in terms of what they accomplish. Is that right, Steve? Is that the
I
idea?
apologize. I apologize, but yes, actually, at any given time, we have had as many as 4 judges operating. It has put a strain on the resources. You could have the support magistrate, 2 family court judges, as well as a 3rd acting as family court judge in order to carry out juvenile delinquency activities as well. So with that type of activity, when we've had that type of activity, it's been very difficult. I don't want to forget, we've also got a court referee floating around here. So you could have as many as 5 different proceedings running all at the same time. And space-wise, I know from having spoken to the judges, having been in those courts, it's very difficult for them to coordinate the activities so that they have the appropriate space at all given times to carry out all of those functions.
So these are some of the things that this committee that we put together will have to be looking into and weighing before we decide to jump in with the expense and the issues with another one. We might want to try out to see what's going to happen when this gentleman comes in from the other county, Crucially, his name.
Carrera.
Carrera. Go ahead.
Nicole.
Who wants to talk?
Nicole has her hand up.
Nicole, go ahead, Nicole.
Thank you. And maybe maybe another family court judge is not the answer, but for sure we can't have packets of paperwork that are ready to be looked over and decisions to be made on them that just sit and collect dust for 6 months when it's children's lives and families on the line. So I'm just, I guess, looking for some way, some mechanism that we can remove that hurdle and barrier more than anything.
Okay, so we'll be putting a committee together to look into it. Worthwhile? We'll do that. Okay, anything else for is ready to go into executive session? Oh, committee reports. No committee reports, stuff? Good. Is there need to go into executive session?
Yes, sir, there is. And we require for negotiations for personnel, which includes the medical, financial, credit, or employment history of a particular person or corporation or matters leading to the appointment, employment, promotion, demotion, discipline, suspension, dismissal, or removal of a particular person or corporation and appointments.
Okay, is there a motion to go into executive session, Bill Reese? Ms. Haggard makes a motion, Mr. Fay seconds it. All in favor of going into executive session? Aye.
It's the first thing done, right?
Messina, Anne Marie Snell, Potsdam. Move for their appointment.
Seconded by Mr. One more time, brother.
Forsyth.
Mr. Forsyth.
Kio.
Dave.
I'm loving you, Bill, more and more. Love it.
It's a hard one for
It's late.
only known you 45, 50 years.
Ready for it.
I don't know what you want.
Why I get tired? Anyway, so, okay, so it's been moved and you made a second. Is there any discussions on these candidates? No discussion? All in favor?
Aye.
Opposed? Carried.
Where?
Okay,
Bring up, okay.
Mr.
Too late now, I guess.
Ms. Curtis.
Aye.
Operate.
For advisory board for appointments, I have Eric Allen from Colton and Jolene Munger from Norfolk, New York. for reappointments to the EMS Advisory Board, term to expire 12/31/2024. I have Aaron Johnson of South Colton, David Sherman of Watertown, Donald Thompson of Canton, James Barr of Ogdensburg, James Blackburn of Rensselaer Falls, and Tammy Sykes of Canton, New York. And then for the St. Lawrence County Planning Board, we have Eric Allen of Colton and Kitty O'Neill of South Colton.
Okay, any problems with any of these candidates? No?
We need a
Okay.
second on that.
What's that?
We need a second.
Okay, got a second, Mr. Denisha. And, was there any discussion on any people? No discussion? All in favor?
Aye.
Opposed? Carried. Straight.
Mr. Chairman, for second analysis for reappointments for the St. Lawrence County Soil and Water Conservation District Board of Directors, we have Adam Cook of Potsdam. And also for the St. Lawrence County Trails Advisory Board, we have Roger Bennett of Messina. I wholeheartedly support both of these individuals for these appointments.
Okay, makes the motion, who seconds it? Staggert seconds. Any discussion? All in favor?
Aye.
Opposed? Carried. Chair's appointments, I don't have any right now, but I'm gonna have some soon, you'll be knowing in the next few days. Because we wanna get those committees moving. Adjournment? Mr. Bay makes a move to adjourn.